by Dr. Raka. Today's theme cannot be more important, COVID and concerns for children. In fact, if we look at the resurgence scenario today, words fail to describe this reality. We have really no words to say what this condition is today. This morning's report again says more than yesterday. So every day is overtaking a new day is overtaking the previous day. And then the active cases are increasing. The key question before us is why children? Why children? We haven't witnessed this in the first phase, but in the resurgence now we are witnessing. So we have excellent panelists to share the issues, the concerns, and what we should be doing. In fact, in the last few months, couple of months only, more than 80,000 children, and that too between under 5 and under 7 years. Now, and under 5 and under 7, what does it call for? What does that response call for? That is a big challenge for us. The children, infants under 2, under 5, under 7. So what sort of age-appropriate care system when we are having social distancing, when we say keep far, wash your hands, what do we do with the children of this level? So these are very, very important concerns we have in front of us. So I would like to hand over the floor to our key panelists and Dr. Raka. Thank you for this opportunity. And together, I do hope we will come out with some concrete and measurable solutions to change the situation for children and to deliver on the rights of children, because health is their basic right. So we need to work on that together. Thank you very much, Dr. Raka, and over to you.
Thank you very much, sir. Thanks a lot. And now let me start with the inaugural session with the permission of all the panelists and Professor Santosh Kumar here. So should we start with the inaugural session now?
Please go ahead, Dr. Raka.
Thank you very much, Santosh sir. Thanks a lot. So first of all, I would like to invite Professor Santosh Kumar for the introductory remarks about today's workshop. And before that, I would like to introduce Professor Santosh on this platform before all the panelists and all the participants here. Professor Santosh is a disaster risk reduction policy planning and capacity development expert with 2.5 decades of experience in different positions in the DRR sector. He is a doctorate in economics and studied gender and development in the IDSSX UK and received professional training in disaster risk management from Israel also, and that with several international works exposures at the World Bank and intergovernmental body of SARS. He has also worked with the state level, grassroots level organizations like the UK Academy of Administration, Nainital, and Rajasthan Institute of Public Administration. He has a lot of experience from the international level to the very grassroots level. And sir, you know that, sir, second, sir, we all are witnessing, and we all are every day we are witnessing, and something in this surge has been really very we have to focus, I mean to say, a matter of concern that children are being hit very hard during this time, this second sir. So, sir, most welcome for your introductory remarks, and sir, over to you.
Thank you, Dr. Raka. Am I audible?
Perfectly all right, sir.
Thank you very much. First of all, let me welcome Sri K.M. Singh ji, former member of the National Disaster Management Authority, and also the recipient of Netaji Subhash Chandra Bose Award conferred by the Government of India. I also welcome Dr. Sandhya. She has been very, very supportive to CCDRR and NIDM initiative. I welcome Mr. Ray Kacharia, our old friend and colleague. We have worked on many of the forums related to children. And of course, Dr. Pooja, I have been interacting virtually with her in many of the webinars which we are organizing. So we have been benefited with her intervention. She always say that don't say that children are committing suicide, if I'm correct. So that point has gone deep into me. It's not that children are committing suicide, but they are forced to into this kind of a situation. First of all, to this particular forum, all the dignitaries on behalf of National Institute of Disaster Management and on behalf of the child-centered DRR, I extend my heartfelt welcome to all of you on an important deliberations. But before we start, I wish to express my deep condolences to one of our colleagues from National Institute of Disaster Management who succumbed to this COVID-19. He passed away last evening. And today we are having this workshop on the COVID-19. Very difficult situation, and we do not know what will happen next. What Dr. Raka has introduced me, there's so much of experience, 25 years. And like me, many people who are working in this sector. Even if you count 1,000 people in the country and you multiply by 40 years of experience, then it will be a 40,000 years of experience of professionals working in the disaster management in the country. But country is still facing as a kind of a situation which we never been into the last 100 years. Today, economist has quoted about this, what happened 100 years ago, and the large number of deaths happened from India. But over the years, we have not been able to learn lessons from those situations, despite the World Bank report in the 1994 and 2004 brought that looming pandemic large before the humanity. But most of the government of the world, they ignored this warning, and we continued with our passions of development without recognition of such kind of a disasters. It's a very painful exercise to speak on such situation where we have not been able to change the situation. Whether we call it related to children or we are related to the elderly. Last time that the elderly succumbed more, and this time the children and the elderly both combining together. Difficult situations, but we say that this is also a time that shall also pass. But we do not know how much cost which we have to pay for this. These uncertainties are still there. So in this kind of uncertainties with heavy heart, I would extend my condolence to all those family members who have lost in fighting with this COVID-19, their loved ones. And I'm hopeful. We always say that always look for the brighter picture. Things are happening. We are saying that 30 lakhs of people are affected, but we are also saying that 100 crores people are not affected. So this is also positive thinking, which we can say that we can start with that kind of a positive note, that those who are not affected, those who are providing services to the people, they are helping people. And good model has emerged yesterday that earlier we used to know about the langar for the food, but yeah, day before found the langar for the oxygen, the medicines, langars for the lifeline support. It is a very, very innovative model which this Gurdwara committee has been able to brought in the management of disaster management. Salute to them. So how these models can be replicated in the form of the new challenges we are facing. And we see many such kind of langars in the country all over, which can extend support system to the people, those who are likely to be affected, we do not know who will be affected next. So in this kind of uncertainty, we have to operate. So this is the time to listen to the experts. I would just flag some of the points in terms of that. What is the expected capacity which we have for fighting such kind of problems? Number two, I'm wearing mask because I'm flagging this issue, and Dr. Sandhya is also there. Other two doctors are also there. Because it has been said that now so confusing pandemic and messages which are moving across the globe on the WhatsApp, this social media, and also that print media and electronic media, this is airborne. What is this meaning of airborne? Whether my daughter is asking me to wear mask even at home. When I was sitting in the morning in the balcony, I was taking fresh air and I was exercising. She came and said that, no, it is airborne, come inside. So can we say that the whole atmosphere has become poisonous or this infected by this? What is this definition of airborne? When to wear mask? Mask is essential, but whether 24/7 we have to wear this to protect ourselves? Because we say that this is a 97, 98% of the efficacy if you wear this. But vaccine has just 75% of the efficacy. The combining the two, that you have a vaccination and you also have this, then you will have probably 100% of efficacy. But the kind of mutations which are happening, this also not giving you the right picture to guess that what kind of a support system which you require, or what is the capacity which we need to have for the future if this pandemic, even today and times to come, and also maybe we have to prepare for 100 years kind of a scenario. And that scenario is very important, that what, like at times you produce vaccine and at times you don't distribute this vaccine equitably to all. So it is restricted because of the scarcity of supply. So that most vulnerable initially was thought of that elderly people, but now today it is discussed that is even the younger and also that the children. So how the priorities would be set while deciding that who should be vaccinated first. So this is another challenge for protecting children. The third issue is that whether the support system will reach to a kind of a government capacity, or we have to government, civil society, or Gurdwara kind of initiatives which we had longer approach, or this how we are combining together, even if we are not meeting in person, but we have to meet and start working for that. Then the fourth is that how the service providers can be protected. There's a huge risk also, like if you know that somebody of your relative of yours is not pulling on well and they are affected with COVID-19. And then you have to provide your own services. In the house, children are affected and parents are not affected. That is a situation also emerging. So how the parents can cope with the children's support. And when the parents are affected, then how children will cope with that kind of a vice versa kind of a thing. So these are the issues which are I wanted to flag. Vaccination in India will take long time. We can't saturate the whole population in a coming 8 months of time because it is a very, very challenging one that availability and also that getting it done delivery system that is also required. So the government is taking decisions, and in those decisions, how we can the cog in the wheels, which we say that we go into a kind of a seamless integration with our own capacity. So how holistic we can address these issues. Many people are into panic and trauma, and everybody is now, whenever I'm calling anybody and they are into deep trauma, that they are fearful about this tomorrows. We say that if you think about tomorrow, you get worried. If you think about today, then you are happy. But we are not here. It is not helping us. We are going again and again in tomorrow's dilemma. That what will happen X and Y and kind of a scenario which we are building. So I'm sure Dr. Pooja will help in this deliberations that people are going into crisis, how the children and the parents can go together. I would end here, and once again I take this opportunity to welcome all of you here, all the stalwarts. They are here, and I'm sure that NIDM would get benefit out of it. And CCDRR, Dr. Raka, Dr. Balu, and Mr. Ranjan Kumar with us, all will take up those agenda forward, making our children safer. so that we can make a special intervention for protecting our children. And our job is to, as a CCDR, to look into that. So I would be grateful to all the panelists and the resource persons, and also the distinguished participants who have joined their interventions by questions and the chat box. They can always suggest us something which we can carry it forward. Thank you once again. Thank you very much to all of you.
Thank you very much, Professor Kumar. Thanks a lot. Very rightly set the tone of them for the entire workshop, flagging out very important concerns over which our eminent experts today will be.
Dr. Raka, your voice is not clear.
Discussing. Thank you very much, sir. Now is it clear, sir?
Yeah.
Thank you. Thank you very much for setting up the tone for this workshop today and flagging out the very important concerns which our eminent speakers and experts will be dealing with today. Thanks a lot, sir. Without taking much time, I would like to invite now Sarabjit Singh Sahota ji here, who is the disaster and emergency management specialist with the UNICEF. So,
Sarabjit is also here. I could not see him. I once again welcome Sarabjit, our partner. UNICEF is our partner and they have been supportive. Dr. Sarabjit, you are welcome.
Thank you very much, sir. So, as all of you know that for this workshop, UNICEF is our partner, and this CCDR Center is also under the guidance and patronage of UNICEF. So, most welcome, sir. Let me introduce you before inviting you over the platform. Sarabjit sir is by profession, he is an architect, not profession, I mean to say by expertise, and urban planner with over 2.5 decades of professional experience working as a frontline humanitarian and development with humanitarian and development agencies. He is currently working with UNICEF as a disaster risk reduction specialist. He is experienced in steering development and humanitarian strategy, leading organizations, programs, and projects with frontline agencies in the domain of community and social development, humanitarian program management, capacity development, disaster risk management planning, urban planning, and design. So, Sarabjit, sir, over to you for apprising all our participants and panelists about this workshop with your address. Over to you, sir.
Raka.
Yes.
Also welcome Dr. Somsekhar and Vijay Singh. I could not see them. I'm sorry, my apology, but I welcome all of you.
Sir, actually, Dr. Rajiv has also joined, Dr. Naveen Thakkar has joined, and Somsekhar sir has also joined. So all our panelists are here. And Vivek, Dr. Vivek from UNICEF, health specialist of UNICEF, has also joined.
Thank you. Please.
Yeah, Sarabjit sir, over to you.
Thank you. Thank you so much, Dr. Raka. It's always a pleasure to be with NIDM on this platform, which we have jointly created. I will straight go on to the point. In any emergency, there are basically two tasks to be done. One is that you have to manage the situation. And you know what is the situation in the current context. And second, you have to address certain specific technical problems. So problem solving. So managing a situation, addressing a situation, plus addressing the technical issues, the solving the problems. Now, the people who have joined us today, all of you are technical people, and it's so heartening to see all of you here. And I'm looking forward to listening to particularly Dr. Vivek, Dr. Thakkar, and others who have got real good ideas about what to do. Unfortunately, the voices of technical people are currently not very loud enough. My first thought goes out to you that we would like to hear more from you. We would like to see you being empowered and advising all the administrators across the country, from local level to national level, at every level, people need your help. So step up. You've been playing for a long time on the back foot, but I think it's time to play on the front foot, if I may use that cricketing parlance. Second point I thought I should share here, and this is because we work across the country in 17 states. And one of the things which, a couple of things which are not working, which really impact children's health, well-being, and currently their exposure to the COVID risk. So what are these underlying things which are impacting them? So one of the thing is the perception and priorities of different stakeholders are not matching. Now, who are these stakeholders? Political class, families which are directly impacted by COVID, that's the second stakeholder to me. The third stakeholder are technical people like you, the epidemiologists and the disaster managers, the disaster risk governance experts, and a range of technical people. So all these are, to me, the third big block of stakeholders. The fourth one are the bureaucrats, the administrators, so that class of people. And the fifth and the most important, most probably, is the civil society, the NGOs. And to me, what I'm seeing, what we are seeing as an organization, that perceptions and priorities of all these five stakeholders are not matching as much as necessary, which means probably we need to coordinate more, we need to talk to each other more, we need to listen more. Okay? So that's my suggestion, that the technical people speak up, and speak up in a coherent manner, so that people can listen to you and implement what is necessary. And today, what is necessary is that we protect our children from the emerging risk. There are direct risks of the disease, which there's no doubt about it. There's enough evidence now. Children are getting directly impacted, but there is a whole lot of indirect impact within the current context. Their education, their protection, their health and well-being, their psychosocial well-being, everything has been impacted. We are staring at a generation which where large number of school dropouts and so on and so forth. So both direct and indirect impact is huge for children. So I'm looking forward to listening to all the experts today, particularly on the direct side of it. I think we have fair good idea about how to address the indirect impacts, but the direct impacts to children, I think this is still a very emerging and field which is still not very clear even to the technical people. So looking forward to it. Thank you so much, Dr. Raka, for giving me this chance. Thank you, Professor Santosh, for always being with UNIS in a lead to this partnership. Over to you, Dr. Raka.
Thank you very much, sir. Thanks a lot. Now I would like to invite Dr. Vivek, who is the health specialist with UNICEF, and he has been a faculty at Emory University, Rollins School of Public Health, Atlanta, and he was also the regional editor for the Lancet for India for 3 years. 20 years of global health experience, and he has a lot of experience working with the state governments, academia, and the World Health Organization, and now with the UNICEF. And Dr. Vivek, I would like to invite you to address our participants. And recently, since from your bio, I can see that you was associated with Lancet, and Lancet has come up with some very good research about this resurgence of COVID-19 and how India should deal with that. They have come up with a lot of recommendations and many points related to children and how we have to handle children in that report is also included. So Vivek, sir, over to you. We would like to listen to your ideas.
Thank you, Dr. Raka, and good morning, everyone. All my seniors on the panel, and Professor Santosh that I know, Singh sir, and I see Dr. Naveen also. So I would also like to acknowledge that there are about 360 participants who are listening to this event today. And I'm sure that this topic of protecting the rights of children is also close to them, and they will be further propagating of what we discussed today as a group. Let me put a few things in perspective and some specific questions with regards to children, especially when I see pediatricians of the like of Dr. Naveen and others can be taken by them. But I will put 4 or 5 things in perspective from what I've listened from Dr. Santosh sir and Sarabjit, of course. First of all, if you look at the history, and if you realize the name with which UNICEF started on 11th of December in 1946, it was United Nations International Children's Emergency Fund, which began in World War II, and then it became UNICEF as United Nations Children's Fund. Never more than the existence of UNICEF, the realization that this is an emergency and we need to protect the rights of children has been more important, especially in India. And this is where we appreciate the roles of the child-centric DRR Center and all the civil society who are working to protect the rights of children. I think this is the time when we have to pull up our socks and make sure that for now, we can park things like school closure and all that for a later date. Today is the right to survive for the children. That is most important, and how we can work on that. Now, another important point to put in perspective. If we look at the data from India, what we are seeing in the first 3 months, and I'm looking at data from ICMR, and of course, which is a Government of India data, the proportion of children affected by COVID directly in the age group 0 to 5 has not increased statistically significantly. If it was in the range of 1% to 1.4% in different states in India, that range is not increased statistically significantly. Now, what has increased is India, day before yesterday, crossed the highest ever cases of COVID in the current pandemic in any country, which was on 21st of January in the second wave in the US, which was 3 lakh something cases. 2 days ago, we surpassed that. And now all the records that we make will be the highest ever cases seen of COVID in any country in this pandemic. So it is this absolute number of increase in cases, which has led to absolute number in increase in cases in children. So my first point is, when there is a storm, you do not try to calm the storm. You calm yourself, calm the panic. And that is when you are in your best of intelligence to be able to respond to the pandemic. And why I use the word intelligence, because I was listening to a journal yesterday, that it's absolutely a warlike situation. But what happens when you have to win a war? The first thing is, you have to have whole nation united. Unity is the first principle. Second is, if you have this typical army parlance of C4I2, that command, control, communication, and you talk of intelligence usage and information technology today, then also you need to make sure that you are united, you are speaking the same language, you're only talking of positives, negatives, and all retrospective introspections of what went wrong by whom will be parked for later. Not interested in talking that today. Today, we are only interested in talking of solutions, talking of positives, what can be done, and who needs to do what. So I think this is very important at the very beginning to set the tone that we have to only talk of positives, and positives for children today. Let me put on record what I'm hearing. I'm a member of the IAP task force, which is coming out with the pediatric guidelines and messages for parents. By Monday, it will be disseminated. Government is also releasing today the guidelines for pediatric management, which is being adapted from AIMS by the DGHS, which will also be up and about on their websites today. What I'm hearing from the pediatricians is most of the children will be easily managed with just the symptomatic treatment for fever and cough. And for those who understand clinical medicine a bit, and I'm leaving this to all the eminent pediatricians, and I see Naveen sir again, as I had mentioned, that even the rarest of the situation when children get affected, what we had heard last year was multi-system inflammatory syndrome. So even that is very rare, very rare. And there is a slightly lesser version of that, which now the pediatricians are calling the febrile inflammatory state, where and I'm talking in clinical terms, where the inflammatory markers are raised, none of the organs are showing involvement as the MIS in children, and there is a continued febrile state. Even that is managed only on antipyretics and close watch. And children are coming out, they're not progressing to the MIS in children. So what I'm trying to again reiterate is that our message to the parents is most of these kids will not get serious disease, will pass off. Now coming to the topic again at hand, that what are the concerns now for children? And this is where there's a range. So on one hand is the clinical disease itself, how children should be protected, how the parents need to stay calm, that most of the children will not land up in serious disease. And on the other end of the spectrum, for example, yesterday through our Sphere network, we were trying to support families. So I'll give a real life scenario from yesterday. Mother and father hospitalized, grandmother in Rohini taking care of the child, two children, sorry. There were two children, grandmother taking care of two children since 8 days. Grandmother falls ill, nobody at home to take grandmother to the hospital and feed the two children. And 1098 child line responded immediately. And within 1 hour, the children had food. The grandmother was also taken care of. So I'm stressing on the fact of 1098, the child line, and the likes of it. So many NGOs are coming forward. So the range of support that children would need at this time ranges from their own health, for which they would need some guidance from doctors, to, let's say, if their families are affected, then who takes care of the children? That's the other end of the spectrum. So all that we can do for children, and this is where when I heard that we also have colleagues from Save the Children, one of our colleagues from Save the Children was yesterday listing of all the NGOs, district-wise, state-wise, of what they are doing for children. Let's say they are providing free clinical consultations. Let's say they are providing food for children whose families are affected. Let's say they are providing other support. So there are agencies which are listing that. And when I mentioned that at this time we need whole of society approach, so let's focus on that. Now, the last point that I want to make is that one of our previous United Nations Secretary General Ban Ki-moon, he had said that civil society is the oxygen of society. And I'm stressing on oxygen because we know that how oxygen has become a life-saving drug today. So if civil society is the oxygen of society, we need the whole of society approach to protect the survival and thriving rights of children today. We need everyone to come together. And I would end by saying that I also look forward to listening to other eminent panelists, but we need to only talk of positives today. We know that most of the children's, by God's grace, will pass off with very mild disease. And we need to focus on what can be done by engaging everyone, taking everyone together. Thank you very much. Back to you, Dr.
Thank you very much, Dr. Vivek. Thanks a lot. Now, without taking much time, I would like to invite Sri K. Singh sir who is the founding member of National Disaster Management Authority and presently Vice President of Policy Perspectives Foundation. Sri Ken Singh is a 1968 batch Maharashtra cadre IPS officer and who served in the Intelligence Bureau with Government of India for nearly 3 decades in the Indian High Commission, London as Minister also. Coordination from 1996 to 2000 as Director General of CISF, Central Industrial Security Force, from 2003 to 2005. During his tenure in IB, he served in Jammu and Kashmir for 7 years, and after retirement in 2005, he was appointed as a member of the National Disaster Management Authority with the status of Minister of State in the Union government, and he served in his capacity in NDMA for over 8 years till 2014. And he has been responsible for conceiving and raising the National Disaster Response Force from scratch to its present status. And in our disaster management community, we used to say Ken Singh sir, the Bhisma Pitama of National Disaster Response Force, actually, father of India. And presently, he is vice president of a think tank, Policy Perspective Foundation, a Delhi-based think tank. And also, sir is the very first recipient of very prestigious Subhash Chandra Bose Apada Prabandhan Puraskar in year 2020. So, most welcome, sir. I would like to invite you for the keynote address of this workshop today.
Thank you, Raka. Thank you for the introduction you gave. Well, the outset, I would like to thank NIDM and all the members for inviting me to this. You must have heard from Raka in my introduction. I'm not a specialist on this subject. I'm neither an expert, nor a professional, nor a doctor. And I feel humble to be talking and in fact giving keynote address in this August gathering of experts and panelists. So what I will be talking is only my perception, because I have been dealing in the NDMA on this disaster response side. And from that angle, from the response perspective, situation, I'll be talking on that. I'd also like to compliment NIDM for organizing this webinar on a very related to concern and safety of children. Well, Dr. Vivek gave a very rosy and optimistic picture as far as threat to children is concerned, or vulnerability to children is concerned. But in whatever little experience I have in the field of disaster management, particularly on the response side, say that prepared for the worst scenario, prepared for two major disasters coming together. Preparedness is very important. So to that extent, here, I would not like to be an optimist. I would not like to give a very rosy picture. And I feel this wave, the tsunami of COVID-19, in this, it is not going to spare anyone, from a child to adolescent to youth to young people, elderly people, senior citizens. Nobody is going to be spared. And so I would prefer that we should have any sense of decency, particularly in respect of concern for and safety of children. In fact, the situation today that we are, in fact, last year we were thinking that vaccination is coming, and maybe by the end of 2020 or beginning of 2021, life will be back to normal. No one could visualize that the situation will become so alarming in 2021. And if that is so, I don't think we should presume that the situation will become better in times to come. In fact, if you see the rate at which vaccination is being done presently, we will be able to vaccinate maybe in about 2.5 years of 100 crore population out of 150 crores, 140 crores, 2.5 years. That is the rate that we are vaccinating. But mind you, this vaccination is only for 9 months. So those who are getting vaccinated now will be due for after 9 months. So one is the time frame of 2.5 years, other is the new people becoming due. How are we going to cope up with the situation? It's really very, very alarming with no light at the end of the tunnel. But here we are discussing about children. Now, with due respect to what Dr. Vivek said, I would say that we should not be going into complacency as far as children are concerned. Right in the beginning, Dr. Aka mentioned, and other speaker also mentioned of the figure Ministry of Health and Family Welfare, that in five states alone, I repeat, 5 states alone, the figure of children affected is nearly 1,000, to be precise, 79,688 is the figure given by Ministry of Health and Family Welfare. This figure covers children from 1 year to 6 years. Children from 8 months, repeat 8 months to 12 years, are getting severely affected in Delhi. As per media reports, out of total deaths of corona in Gujarat so far, 15% are young patients. If we compare with last year, in Haryana, only 1% children were affected last year, whereas today, the figure from Haryana from March 15 to April 11 is 8% children affected, from 1% to 8%. Cases of infection have been found in 14-day-old children as well. So, with this, I would beg to disagree with the optimistic picture given earlier and saying that we should start on positive note. As a disaster management, whatever expertise I have, I would rather approach the subject with a pessimistic note to overcome the problem so that we are optimistic. In that context, in fact, it is on record that we got the warning in India of the second wave way back in October 5. It's a huge country, vast country, lot of problems. And we did not really prepare ourselves to face this situation, and which we are saying. So, educating children, taking care of children is very important. I'm very happy with the remark of Professor Santosh when he said that he is sitting today in this webinar with his face mask on, because in the morning today, his daughter said, when he was sitting at the podium, put on the face mask because there is virus in the atmosphere also. Now look at the girl and her suggestion. So why I was very happy to hear this from Santosh is that if parents are educated, parents are made aware, if they tell the children may or may not follow it. But when your children gives you a caution, gives you an advice, gives you a warning, the parent listens to it. So, and that's true what Santosh said. So, we always believe, and UNICEF will agree with me, that taking care of children, educating children, making children aware has double benefit because you are preparing the next generation. Next generation. So let us see from that perspective and let us not be complacent. Now, when we talk of children, the different age group children have different problems. Children under 5, they get infected from family members who go out and do not adhere to the COVID-19 protocols, and they bring the infection. Problem with children 5 years and above. They go out, they are not sanitized, they are not aware of the threat, and they are highly vulnerable. And children, most vulnerable children are in the poor families, in the rural population. They have to be addressed. So I would beg to say that while we are as a nation trying to deal with this second wave with as much resources as possible, as much initiative as possible, but there is a near total lack of awareness regarding serious threat posed to the children by the second wave. And why I'm saying so is that our vaccination program started with the mindset of COVID situation last year, that vulnerable people are senior citizens, elderly, people above 45 with COVID. And that's the priority in the vaccination in the beginning. Now that process changed, and from May 1, youth above 18 are eligible for vaccination. But I don't know why, what is the reason, but this clearly indicates that in the perception of what was made of the speakers here, I think Dr. Saha, that who are the important stakeholders? The politicians, the bureaucrats, and the technical experts. I would like to ask them that you have said that vaccination will be only for 18 plus. Does that mean that you feel you, the policy decision maker, you feel that children below 18 are totally immune to any threat from COVID-19, the second wave? So, by Dr. Sahota, that perception and priorities of the stakeholders are not matching, and problem. And I think this statement of Dr. Sahota is very, 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 And that is borne out of the fact that ICMR says that children 1 to 5 have no threat. The vaccine can I may be wrong, probably, but I will to disagree. I don't agree with this perception. The vaccination should be open for anyone, even it's a medical reason why they should not be vaccinated. Not being a medical doctor, I am not aware. So I beg to apology for that. So, in my perception, what is important is that, and that is the imperative of today. Number one, that as Dr. Sahota mentioned, that there should be commonality, a common approach of the perception of and priorities of stakeholders, starting from politicians to bureaucrats to experts, preparing for the worst scenario. Not only today, probably things are going to be in times to come. And to that extent, if there is a common perception, then there is a need to launch a drive of awareness generation relating to vulnerability of children in the second phase of coronavirus. In this awareness generation, do's and don'ts and various safety concerns also need to be addressed. Targets should be the people, poor people, the people from rural areas, because many of them are illiterate or semi-literate. They have no access to TV, radio, or social media. They must be made aware. And this awareness generation among the stakeholders has to be done in a comprehensive manner in association with municipal and local bodies, RWAs and Mohalla committees in the urban area, and with at the village level, panchayat level, Anganwadi level, etc., in the rural area. I'm aware of the fact that some of the national and international NGOs are doing commendable work in this field. But we need to address this problem. Is that adequate? I think the awareness generation program has to be done in a structured manner with the initiative coming from the government, and it has to be done in an institutionalized manner. This, I strongly feel that in today's scenario, involvement of corporate sector as part of their corporate social responsibility will also be helping in a big way. I would like to impress on one more point before I conclude, and that is the impact of COVID-19 crisis on mental health of children. In this crisis, children are likely to face enormous disruption to their lives. Children are likely to experience the same worry, anxiety, and fear as their parents. That is the fear of death, the fear of their relative dying, or fear of non-availability of medical treatment. Now, as far as children are concerned, as the schools were there working, they had the benefit of being with their colleagues, peers, and a social support among their students, a structural environment in their school, with the friends and all that. So that provided a good social support to them. But with the schools not being there, the issue of concern of mental well-being of the children is very, very important. And this entails the responsibility on family members, particularly parents and mothers, to provide requisite psychosocial support, mental support to children. And this issue of educating parents, educating family members, educating mothers of the importance of awareness of the importance of psychosocial support to children to cope up with this unprecedented tsunami of COVID-19, in which they are also likely victims, will be very, very important. So with these few words, I would like to conclude. I would also like to beg apology of experts if my person is wrong anywhere. I would also like to beg apology from Dr. Vinay for not agreeing with his very positive scenario, which may lead to a complacency in my view. And with this, thank NIDM once again for giving this opportunity to me. I would look forward to a very, very good recommendations from the NIDM to be sent to the government in this field, which is much, much, much needed today. Thank you, NIDM. Thank you, Dr. Raka. Thank you, Professor Santosh, and everyone. Thank you.
Thank you very much, sir, for this wonderful keynote address and putting up all the points in a very focused manner. We, as always, delighted by your experience and in-depth knowledge about the topics. Like you were telling that you told that you are not the expert on the topic, but we can see the wisdom and very in-depth understanding of the topic by your speech. Thank you once again very much, sir. Now, if you kindly, all of you, allow us so that we can move towards our technical session, sir. James, sir, Professor Santosh Kumar, sir, Sir Ajit, sir, a lot of thanks to all of you. The inaugural session is almost over now. So if you allow us, then we can move towards the technical session.
Dr. Raka, if you allow, I have one point to make to some very important thing that Singh sir said, so that it doesn't lead to any confusion.
Yes,
so,
please be.
And this is for all the audience.
Yeah.
Sure.
Yeah.
So when I said in a warlike situation, which I meant that we have to first accept there is no room for complacency. This is a disaster. Now, when I come to the fact, when I said that the proportion of children in the age group 0 to 5, and sir, we are very right. You're very right. We have looked at the data. Some of the media, when they said 1% to 11%, what they added was the age category 6 to 19 from the data. There has been increase when you look at the data, but very marginal in these respective age categories, point one. Second point is that there is no room for complacency. We have seen what the country has come into because of complacency, and all of us. That said, there is more likely of the clinical fraternity who's not well informed to do more harm to children with cocktail of medicines than good if they don't realize that most of the children will still have the same clinical disease spectrum, that most of them can be managed easily at home. So that was the message. There is absolute no room for complacency, but there is also a need for the likes of pediatricians that we see today on the panel to tell what is the reality in terms of the clinical spectrum of the disease. Is it actually 1% or gone up to 11%? I'm sure they will refer to it. And with regards to the vaccine, also the points that you made, there are clinical trials going on. We know that the way immune system develops in children is different from adults. So now the same vaccine companies are under clinical trials. The same vaccines are being tested in children. Results likely by June, end of 2021, we will have candidates, and it will become an ethical imperative to also protect our children on that.
Thank you very much, Dr.
Thanks,
thanks a lot.
Thank you.
केम सिंह सर, प्रोफेसर संतोष सर, अगर आप allow करें तो should we move for the technical session now?
Go ahead.
Yeah. Okay, thank you very much, sir. Now, one of our today's eminent speaker, Professor Rajiv Das Gupta, who is the chairperson of Center of Social Medicine and Community Health at Jawaharlal Nehru University, New Delhi, is with us. And let me tell you that there are personal problems in the Sir's family, and even after that, he is with us here on this platform today. Sir, I extend my wishes for early recovery of your near and dear ones. And let me introduce Professor Rajiv Das Gupta, and he'll be speaking over the topic from a public and community health perspective, actually. Professor Rajiv has served a decade with Epidemiology Division, Municipal Corporation of Delhi. He was a Fulbright Senior Research Fellow at Johns Hopkins Bloomberg School of Public Health during 2010 and 11, and an adjunct professor at the Faculty of Health, University of Technology, Sydney in year 2016. He is a member of National Certification Committee for Polio Eradication, National Verification Committee for Measles and Rubella Elimination, and the National AEFI Committee. He is closely engaged with the Ministry of Health and Family Welfare, National Health Mission, Indian Council of Medical Research, and the World Health Organization in policy research and program evaluation. He is a regular commentator on public health issues in national and in international electronic and print media. I was watching a few days over, sir was speaking on various platforms with regular district in search. And sir, today we would like to hear your expertise from the public and community health perspective with a specific focus, or rather focus on the children. So most
thank you. Thank you very much, and my thanks to the NIDM for organizing this. A very distinguished set of co-panelists. Very fortunate to be able to listen to you. And I'm aware each one of us in our own families, among our own neighbors, each family today is battling COVID, and each one of us are going through very difficult times. And I hope that how we respond as a society or a community will have a huge bearing on how things go. And including how we will be able to address the needs of our children. I will not take much. There are many eminent pediatricians and clinical specialists and child health specialists here. I'll just take about 5 minutes, perhaps focusing on the big picture. There are two broad aspects to the big picture. One, of course, is the current crisis in provisioning of medical care that we are witnessing. This is both a medical clinical crisis as well as a tremendous humanitarian crisis. In Delhi, particularly, what has caught the attention of the international media is how Delhi has been overwhelmed. So both Delhi and Mumbai, the political capital and the financial capital, both have been overwhelmed. And that's one big story. But the other big story, which is what I would focus on purely from the public health point of view, is the story of what's been happening in the few previous months. And there is a lesson there, because that has a bearing on the way forward as well. So a very important question that everyone has been asking, and also everyone has been providing answers left, right, and center, is what happened between roughly December when it bottomed out, and suddenly this surge from about mid-March or end March, and particularly the ferocious velocity with which Delhi and the National Capital Region has been affected. The story actually goes back to end December, which is when the UK variant was first imported, or at least first identified in India on 28th, 29th December. The UK variant emerged, or at least was first identified in the UK in September 2020. Very rapidly, it went on to become the dominant strain in the UK. As one specialist expert put it, it very fast moved from a trickle to a torrent. And that really describes what happened in the UK. It established itself as the dominant strain. By mid-November, the first imported cases were identified in Europe, one in Portugal, the other, if I remember correctly, in Spain. And very soon it started spreading both in Europe as well as in the US. And the whole world was really anticipating with fear how fast it would spread to other countries. By end December, or at least by mid-December, it had spread to nearly 100 countries across the world and was on its way to gradually establishing itself as the dominant variant. And therefore, India was also extremely concerned about this. And on 25th December, a national consortium was set up by the government of India of 10 national labs to maintain this genomic surveillance. So the first UK variant was identified around 28th, 29th December, not just at one place, but at 3 cities in India where international travelers arrived. By February, it went on to cause havoc in Punjab, or at least in some districts of Punjab. It spread rapidly. The hallmark of this new variant, or any new variant in general, was that it started affecting younger adults more, and it certainly started affecting children more, which was not really an important feature in the first wave. So currently, my guess is the pediatric affected population is nearly 100,000, because several days back it was 80,000 plus. I don't have a correct count, but if that 80,000 figure is correct, it would nearly be 1 lakh by now. And I'm sure clinicians among us who see pediatric patients would be seeing what's happening to children getting the illness or the infection. That really is the Punjab story. Punjab started identifying the UK variant at PGI Chandigarh. Punjab kept on stating and alerting that the UK variant is certainly causing a lot of cases in many of their districts. The mortality in Punjab, in some of the Punjab districts, rose to as high as 3.5 to 4%. That 4% is the CDC benchmark. Forget what it looks at the national level. At the national level, it will always look less in such a big country. At the national level, it will always look around 1.5 or so, but it is really district level that we need to look at. So if you see some of the districts of Punjab, it was between 3.5 and 4. Parallelly, in early February, the other mutant, which is what is popularly known as the double mutant, emerged or was identified in Maharashtra. BJ Medical College, Pune, first identifying it. We know it initially spread rapidly in the Vidarbha region. Roughly around middle of February, Amravati district had 57% test positivity rate. Currently, Delhi's test positivity rate is around 30%. And you are seeing what's happening in Delhi. I mean, everybody is seeing what's happening in Delhi. So you can gauge with a 57% positivity rate in Amravati what Amravati and its adjoining districts went through. At that time also, Maharashtra kept asking for more genomic analysis, because, and in a moment I'll tell you why this matters. Parallelly, in early December, another strain which is popularly known as, but the government doesn't encourage that nomenclature, of triple mutant, but the double and triple is unimportant. The important thing is whether it spreads rapidly or not. Emerged in West Bengal, also called the Bengal strain, identified by the Institute in Kalyani. But through the next several months, as we now know from the data, that strain actually was replaced by the double mutant strain, or B1617, even in West Bengal, which established itself as the dominant strain. Now, the reason I'm saying all this is why it matters. Now, one popular refrain is you have to keep doing the same things. Now, but the same things doesn't just mean wearing masks. That's not the same thing. That's only a very small part of the story. Though it seems it's a very large part of the story, but that's actually at one level, looking at the big picture, that's a relatively small part of the story. The point is how is the state or the health system able to act differently based on genomic surveillance data. Genomic, one of our colleagues, I think Dr. Vivek was using some of the military jargon. Now, to draw upon the military jargon, genomic surveillance provides ground level actionable intelligence, and that is different from, not different from, that is a step beyond having a One India plan, which is what disaster management plans typically start with an SOP, and then it is understood that the SOPs will go through local adaptations. But here is a key difference. Just to give you a very crude example, suppose Maharashtra has, let us say, 1 lakh oxygen cylinders. If I give a population norm or a district norm, Maharashtra will probably send, if it has 20 districts, it will probably send 5,000 cylinders to each district to keep a reasonable balance. But if I know that it is Amravati or Vidarbha that is in trouble, I would at that point need to send 50,000 cylinders there instead of 5,000. This is just a very crude back of the envelope example, but essentially to argue why genomic surveillance data, particularly when a wave is beginning, or when we can see the seeds of a wave starting, why is it important to have that genomic surveillance data, and why the same things have to be, obviously we'll need oxygen. On the face of it, it may see the same thing, but it will need to be done differently. And that's what I think has been singularly missing. States, and remember that the reason I am invoking Maharashtra and Punjab is, remember, till we reached the almost 2 lakh daily count, these two states were accounting for at least 75 to 80% of that load. And that's why Maharashtra and Punjab story is extremely instructive. Now, what has caused this ferocious surge in Delhi? What is happening in Delhi is that multiple mutant forms are at work, and this is the most terrible thing to happen, which has happened in Delhi, and that's what explains this phenomenal surge in 7 days. And it is only yesterday that in a DBT webinar, this genomic surveillance data was shared in considerable detail, and the director in CDC has been quoted only in the last 12 hours or so that what we probably see in Delhi is multiple mutants at play, which is absolutely correct. But then this is actionable intelligence, which actually requires a far greater degree of coordination between the lab system, the central response system, and the state response systems, and down to district response systems. Now this will have, and this is not the end of the story, this is the beginning of this story, because mutants will continue to emerge in such a large country as India. In any epidemic in such a large countries are always actually multiple epidemics. There is enough learning from the HIV experience. So here also we are not witnessing one epidemic, but we are actually witnessing multiple epidemics. Maharashtra is one case, Punjab is another case, Karnataka is another case, and so on and so forth. Right now, as you know, Jammu Kashmir is emerging as again as a hotspot with very rapid transmission of cases. So each state is different, or at least somewhat different, and in India we have to be adaptable and flexible enough in our approach, in our SOPs, to have to be able to deal with multiple epidemics. The role of center, state, and local administrations is equally important, but somewhat different. We need a strong central nucleus for technical guidance, for procurement, for providing resources and so on. But how center, state, and the local levels coordinate, and how a strong center but an equally strong decentralized administration is able to work together with mutual trust it's what's going to shape things in the coming weeks. And I can tell you with great sadness, it doesn't look good. Thank you.
Very much, Professor Rajiv. You actually given us the very profound background of the entire problem, how it has been developed, and what actually can be done to handle the situation. Once again, I would like to thank you, and I would also request, if possible, for you kindly stay with us throughout the workshop, so that if our participants would like to ask you anything, or
yeah, thank you very much.
And I understand that you are having personal problems at family level, so
I need to break off for some phone calls in between, but I'll certainly stay.
Thank you very much, sir. So now let me introduce our next eminent panelist, Dr. Naveen Thakkar ji. He'll be speaking about from the perspective of vaccination, actually, where actually the worldwide research over the vaccination for children is going on, and where India stands in that matter. But before that, let me introduce Professor Thakkar here. He is a well-known pediatrician of Gandhidham and is the director of Deep Children Hospital and Research Center at Gandhidham, Kutch, Gujarat, and an adjunct professor of pediatrics at Pramukh Swami Medical College. Sorry, sir. And in Gujarat, Anand. He is an executive director of International Pediatric Association for the year 2019 and 21, and the secretary of Child Health Foundation. He is also a member of Gujarat Immunization Task Force for COVID-19 vaccines. He is a former president of Asia Pacific Pediatric Association for the year 2016 to 2018, and the national president of Indian Academy of Pediatrics in year 2007. He served as a CSO representative of Gavi board for 4 years, and he is also currently member of Vocal expert group of Ministry of Health and Family Welfare, Government of India, and Indian Expert Advisory Group on Measles and Rubella. His current interest in the area of vaccine hesitancy, and he is leading the IPA Vaccine Trust Project. He is also a steering committee member of Immunization Partners of Asia Pacific for the year 2017 and 19. He is listed among the top influencers for the fight against polio released by UNICEF on World Polio Day 2017, and has been awarded some prestigious awards, for example, Outstanding Asian Pediatrician Award 2012, Rotary International Regional Award for Polio Free World 2010, Rotary Ratna Award District for 2010, and prestigious FIAP Award, etc., etc. So, Professor Thakkar, over to you. We would like to listen your.
Thank you. Can you allow me to share the screen?
Yeah, just a minute, Professor Thakkar. I have to go over the next computer so that I can make you a presenter.
So, till I'm able to share my screen, it's a really pleasure to be back in this platform. last time we attended, me and Dr. Somsekhar attended first time. It was unbelievable. We could convey a message, and this time, it was again a pleasure, a right and opportunity, because we do this all the time, and someone said that you can become so active. So we are very active on social media, and all we look the opportunity to people, and through this platform, again we will be able to convey some of the messages. I have yes, you can see my screen, right?
Yes, Dr. Thakur, your screen is visible. You can go with the full screen now.
Yes. Stop my maybe. If you don't hear me, just tell me. I will. You.
Surely.
So from beginning. Yeah. So. Okay. So my topic today is vaccination concern and issue. But as a pediatrician, many of the things, many questions have been raised, questions and comments, and definitely I would share my view. There is some disturbance. Can you stop other audios?
Your voice is quite clear, sir. Crystal clear. You can go ahead. If there will be any problem, then I'll let you know.
Okay. So the first question, when we say even to vaccinate children, and if yes, why? So we must understand, and I'm so happy to see so many advocates that protecting children against SARS-CoV virus 2 is both an ethical obligation and practical necessity. We'll discuss why. The second point, but we have so children really develop severe COVID-19. That all true. But we have some cases later on may land up in MISC, multi-system inflammatory system, syndrome. But that is not now. The concerns are more. It's not only MISC. Now, it is also now evidence is building that vaccines might block transmission of SARS-CoV-2. So, particularly from the Western world, where we have now evidence that it can also block transmission. So, vaccinating children could have beneficial knock-on effects in the wider community. And as somebody said that vaccine are also important. I don't know what's happening. Okay, do we, so vaccinating, this is from the yesterday, vaccinating children crucial for herd immunity. And I'm happy that we started with this discussion has started and everyone has joined. We are asking this question to WHO from day one to at least have some plan for the children. But as WHO has formed a prioritization framework, and there was actually no mention of children or pregnant women there. And that was, we were demanding from beginning that at least have some plan, and we are happy to see that's happening now. So again, so it is very clear, children are not super spreader. It's a very, very clear now that their transmission potential is low, but still they do transmit. But calling them super spreader was a very, which have been, which was previously thought was not a good thing to do, because that was not true. We know now that it is driven by the more younger people, not children, but the younger people who go out and on the work, and then they bring back the infection and give it to the children and the elderly. But we must know that, like in India, it's not substantial, but still we have immunized. And in most of the parts of the world, the elderly and the the comorbidity, and now with even above 45, and then now we will go down. So as we go immunize more and more people at the later age, then there are more chances that adolescent and children will be contributing more to the spread, because virus always finds a way to survive, and that's why we are seeing now more cases in children. And second wave in India, children are more susceptible to virus and affected severely. In some cases, it will be, I will not go by the 1% or 10%, but we can say that children are definitely more affected. And as Vivek said, if the overall absolute number is so high, when it's not it's futile to count the percentage, but overall number is so high that the children are more affected. We know these mutants are more transmissible. If one person brings in the home, everybody is affected, the whole family is affected. And also some of the cases when absolute number goes up, so that is true for adults also, then even, and I would say still there is no concrete evidence, at least what I know, that this virus is causing more, become more virulent. But total number is, so when total number goes up, the hospitalization will increase, deaths will increase, and we will discuss what's happening with the vaccine, when we are also vaccinating. So, and also if we really in future going forward, if we want to mandatory, open the schools, we will need to, at least we need to have a plan and start working on that and reach there as early as possible. But this is the high time we have to have a plan. And as children were last in the, not in the that priority framework, now it is very clear, as Rajiv sir has said, that you have to. The problem was we never had a plan for the whole population, or if certain, we only had for the high risk population, healthcare workers, frontline health workers, seniors and comorbidities, and now we are opening up, but still there is time. We talk about children and have a plan in place. So this is again, why are more children testing positive for the COVID-19 second wave? Because this is mostly this is a mutant virus at play. No other way can way to penetrate to the children's immunity. Previously, we were saying they are not very prone, but still the disease in most of the children are mild. We can see as a pediatrician, and Somsekhar will also give his comments, that we are seeing the increased number, more getting infected, but the most of the disease is mild, and using drugs which are not useful, not proven in children. Adults somehow we get away, but in children, using those drugs to treat COVID is not a it's not a right thing to do. Now, so what are the issues? The one important issue is, let me tell you, it starts when you do any vaccine trial. Always you involve the healthy volunteers, adult volunteers, and because you are giving into the vaccine, is always given to the healthy people. So it starts with the phase 1 trial. First, it's like animal trials, and then phase 1 trial where you have 10, less than 100 healthy volunteers, which are given vaccine. Then aim is safety, and then main thing is to see safety. And then phase trial where you go little up, some hundreds, and let's say maybe less than 1,000 or so, and where you see safety. Again, immunogenicity, you decide the dose and all that, and then you enter the large phase 3 trial where you also see continue to see safety and efficacy. So the first thing is, children are usually so greater reactogenicity than adults, and so children are included always last in the trial, unless it is for the childhood illness, but still the trial starts with some healthy volunteers. So here now the trials have started. But what are the issues? First thing is because there is a more reactogenicity, their immune system say respond fast more. So many of the vaccine candidates have relatively strong side effect. Like if you see, the side effect doesn't mean serious side effect. That is fever, pain at site, chills, like like weakness like that, and which is known to be more with the vector-borne say vaccine, and then with the mRNA or this nucleic acid vaccine, and least with the inactivated vaccine. It doesn't mean that those vaccines are not good, but so many of these candidates have side effects. So it is, maybe we have to see that how the children, what side effects they have, and so it cannot be hurried up, but then you have to have robust safety data, including periodic focus study and post licensure monitoring in place. It is very easy to open up for all age group or give vaccine which are available, but you need this data to be sure that you are not landing up in any problem. So these are the some of the issues, and like elderly people have less side effects. So we have to see what's happening in children, and trials are going on. Now, do we need to go again for 9 months or 10 months or 6 months to see efficacy? No, we can do bridging study. Bridging study means you see safety, and your number is very small, and you see safety and immunogenicity, and then if it is, you can have efficacy, it is good. The Pfizer and Moderna are looking at the efficacy. They have some data. Covaxin has also started studies in children, but mostly these bridging study is required, and which can be done rapidly. So we don't have to wait for 1 more year, but you can do that. If you have good immunogenicity, safety is good, you can go ahead. And we also have to see, because children receive so many other vaccines, and we have to see that once we have that it should not interfere with other vaccine. It is may not be always, because those diseases are also equally important, are known to cause more damage or more life-threatening than COVID-19 in children. So this is also very, very important that we don't delay that. And that's the what indirect effect were discussed, that we are seeing that there are studies available. There is data where it is known that because of delayed vaccination, interrupted vaccination, many parts of the world are facing the polio outbreaks, say vaccine-derived polio, CVD-PV, wild polio virus in some countries, measles and etc. These vaccines prevented diseases are coming back. So this is also a very, very big consideration for children, that we want to be sure it is not interfering. So how scientists will know that the children, its work in children? So as I said, if you have a data about immunogenicity, and some studies are where the cases are occurring more, where if you do a study, you will come to know, and that data is also, but the main thing will be safety and immunogenicity, and how they tolerate the vaccine, and we decide the dose. That's very important. But again, it will depend on the community infection rates. In countries where there are no cases occurring, it will be difficult to decide whether it has prevented that or not. And if we are talking about transmission, then it will involve taking repeated swabs from the children's nose and pharynx, and that is not an easy job. And but then studies should show that. And some of this Pfizer BioNTech, they are using other surrogate markers to know that whether it will prevent the transmission or not. So these are the different issues. It's not a easy job, and you have to have this in place. And with the speed the COVID-19 vaccines are available, already there are a lot of questions, and I don't think we could have hurried this up more. Only thing what I am talking is that we did not talk about policy for children. That was not good, but there is no question that we could have done faster than that. So clinical trials needs to be completed. They have to be safe and effective, and they are not adult, and we have to see how they respond. And Pfizer and Moderna have completed their enrollment for studies. They are doing trial and they will submit data. We'll have data from say Covaxin also. Covishield and J&J have started trial, but that is halted because of some other reasons, but temporarily. But I think that will be started again, and we will soon have these data. Then again, as I said, we have to show that it is not interfering with other vaccines. It has to be integrated. Where do you fit that? If you go to the very young age, where do you fit? And safety is the very paramount important in clinical trials. So these are some of the early efficacy data which is available, and I will be leaving these slides with you where you can see that there, this is another news. So work is going on, and more trials are being done. Now, let me tell you, when you talk about children's vaccination, but we have to be very clear that if we cannot manage well adult vaccination, then we will have really a difficult problem in children, and more problem, because nobody wants to the France. You can see the news that they are the people are anti-vaccine lobby is active, and just announcement about the policy, and they are active, and the parents are saying we will not allow our children to be vaccinated. So Child Health Foundation has, I am secretary of Child Health Foundation, Dr. Jacob John is the chairman, and we are doing a lot of work in answering at present the adult vaccination. There are a lot of questions, and we have a national leadership forum, and everyone is contributing in different languages. And I will send you the link in chat box immediately after my talk, and we will be very happy to take questions, other questions, and work with you, with the Disaster Management Authority or any NGO, any agency to work more, because we believe that, our aim of the Child Health Foundation is to not only, children health, but also rights. So these are the, very important question. I will just go very quickly, because I know all of you, any subject we keep, we'll end up answering this question. So what's happening now? Because of vaccination drive happening now, and now being planned to, open up, this is a very, very difficult communication challenge and very difficult situation. So what's happening? Those who received vaccine 1 dose or 2 dose, and we have not communicated well, that is still you can have COVID. And what trial data we had that it provides 100% protection against serious disease, death, and hospitalization. That was trial data for all the vaccine. Now in India, what's happening? People are getting vaccination. Even before India, let me say US, where you can see that there is a data available, vaccine of 95%, where some people are having COVID, some are getting hospitalized, and certain number, very small number, has also died. So in real world, it is not possible to say that you will have 100% protection against serious disease, death, and hospitalization. But we know what we know, and even in India, what we know with our colleagues, and we are collecting data. Somsekhar and me and colleagues are doing a study. We are collecting data where we are seeing what is happening exactly. But mostly we are seeing from the healthcare professional, mostly, not 100%, that those who are healthcare professional and others in my family and relatives, those who have taken vaccine, most of them had mild illness. And let me tell you, including myself, I had taken COVID vaccine. I got infection because, my son brought infection from some meeting. All of us got infected, but those who were vaccinated had a very no fever, only cough and cold for malaise for 2 days, and then out of it. So it is what was just touch and go COVID, and we thank vaccine that we survived and didn't suffer. Otherwise, I have a lot of comorbidities, high risk, but nothing happened to me. And same with my wife, she didn't get even fever, and that's happening. And Somsekhar will also tell his experience. So that, but there are certainly some, like Gangaram, somebody gave example. So news was 27 doctors got infected in Gangaram, but there was nobody told out of how many doctors 27 got infected, how many hospitalized, and how many deaths. No death, very few hospitalization with comorbid. So that's happening, and there are some death may be happening, and we need that data in the public domain to reassure, not the what we saw from Government of India, 0.007%. That's not convincing. It has to be more to talk about how many got COVID and how many. And overall, it looks that vaccine do work in protecting you to a large extent from the serious disease, death, and hospitalization. There are many other questions. I will not go, and this is available, and this is work in progress. We are preparing in all the languages. I know these are the common questions which you people have, and you want to know, and you can just subscribe to the YouTube channel Child Health Foundation, or click on the link which I will provide, and you will be able to see video lectures, and we will be continuously updating this. So this is all. My talk was prepared on the base of a Nature article, which of course when trial began. So thank you so much. You can follow me on Twitter. We update and post Somsekhar, me, and others. And we post on the social media. And please feel free to connect anytime. Thank you so much.
Thank you very much, Dr. Naveen. Thanks a lot. You rightly just told us that vaccination is really the need of the hour. And since the vaccine for children is still not available, so we are desperately waiting that the day soon comes soon that vaccine is available for children as well. And you rightly you told that vaccination is not only just to contain the spread, but if even after that, if we are getting infected, the symptom is quite uh, mild actually, and we can handle it at our own. And that's a great thing, and that is how we have to go ahead. And now I would like to request Sri Ray Kancharila sir to introduce Professor Somsekhar Nimbalkar for the next speech, and Professor Sheikh will be speaking about safety, security, and educational concerns.
Thank you. Thank you, Dr. Raka. So it's my pleasure and privilege to introduce Professor Somsekhar Nimbalkar. He has an MD in pediatrics. He's a very well qualified person. Currently, he is the professor and head of the Department of Neonatology in Pramukh Swami Medical College. And he is also a national coordinator since recently for the IAP NNF NRP program. In addition, Professor Somsekhar is also Honorary Secretary of the KMC Foundation of India. He has been an ex-governing body member of NNF and ex-president of National Neonatology Forum of Gujarat State Chapter. And he is a very celebrated academician. He is also a reviewer for more than 30 journals, some of them international. And he has published articles and so on. And he is also very well known for neonatal pain, kangaroo mother care, etc. So, sir, we are very honored to have you in this forum to hear about the safety, security, and educational concerns in COVID and children. Over to you, Professor Somsekharji.
Professor Santosh, sir, he was telling something. Please, sir, please.
I was telling a voice was not clear of relay, so that's what I was thinking to.
No, sir, that is coming perfectly at our end. Maybe the local network problem for a few seconds, sir. If that doesn't improve, then kindly let me know again, sir.
Okay.
Thank you, Dr. Ray Kancharila, Dr. Kumar Raka, Dr. Santosh Kumar, and others from the National Institute of Disaster Management for inviting us. Dr. Naveen Bhai and Dr. Vivek Kumar have set the stage with the earlier talks, and Dr. Rajiv Dasgupta gave us a important understanding of what is exactly happening in the last 1 or 2 weeks. If you can hear me clearly,
Perfectly all right, sir. Your voice is crystal clear. Go ahead. If there will be any problem, then and I'll let you know.
yeah, somebody in the chat is saying that there is unwanted sound. I
No,
don't
sir,
know.
it's local area.
Raka sir, sorry to inform you that after you speak, please kindly mute all other panelists.
Okay, sure. Thank you. So, sir, it's a local area network problem. Otherwise, your voice is coming quite clear. Thank you very much. Go ahead, sir.
Yeah, thank you. I am sharing my PowerPoint. You can, I think, hear me clearly. And
Yes, sir. You are very clear.
good, great. So I'll be speaking a little bit about safety, security, and educational concerns from our last interaction when me and Dr. Naveen and Dr. Rajiv had spoken with respect to children. I remember there were a lot of questions from clinical areas by the participants. So I have incorporated some clinical components also at this point of time. So we were discussing this particular thing. As everyone knows, and everyone must be seeing these graphs, you can see that India has just speeded up in terms of number of cases. If you look at the other countries, United States, Germany, and United Kingdom, from this particular graph, they hardly have any patient. But we are like probably at this point of time, we are at least 4 times the United States cases. This also the deaths usually follow the cases, and you can also see a upsurge in deaths that is happening, and we are seeing that in news reports across India. So coming to the question whether children are more involved, so I'll discuss that in a little bit in detail. But just to remind everyone, it's aerosol transmission which is important. I do remember the comments that were made at the start of the workshop that whether it has become aerosol now. No, the virus has remained the same. Virus has variants, of course, but the method of spread has more or less remained the same. It is aerosol transmission, and the main thing is mainly droplets, but you can have aerosol transmission, which becomes important in closed spaces. And I think it's important now that everyone remembers that when you are in an AC room or in a closed space, that it is problematic, and unless you have your masks on, you can be in deep trouble. But if you're outdoors, it should not be an issue. So sitting in the garden and if there is no one around, should not be a problem at all. There are scary reports on and off, but none of them actually confirm that it is transmission through the air that is happening. It is possible that they could have been infected from personal contact also. So I think we should just be less worried about outdoors and more worried about indoors. So that's something that I wanted to share. Another thing that we have been talking about is whether the virus has become more infective. It definitely seems like that, but we don't know. R0 is the way in which infections spread. Measles is something which spread very rapidly, as you can see on the graph. And COVID-19 had a R0 of more than 1.5 to 2.5. And we do know that the R0 can go less than 1 if we are careful with our COVID appropriate behavior. Masking, social distancing, or physical distancing, and getting vaccinated, and all of these things will definitely drive down the R0. But gathering together in smaller places, gathering at meetings, birthdays with masks off, will also drive up the R0. So the R0 is not a specific single number. It can go up and down depending upon the behavior of the population involved. This is something about household transmission. You can see that people are worried. Now, this is what happens when Dr. Naveen mentioned earlier that he got infected. So he said we are creating a hashtag infected together because everyone in the family got infected. And this is what is being seen. If somebody gets infected in the house these days, almost everyone is getting infected. We don't know whether it is greater infectiousness. The variants are supposed to be 50% more infective, but we really require more clinical correlation along with the genome sequencing that is being done. But let's assume that it is more infectious. We definitely don't know whether it causes increased mortality. But In the earlier studies that were shown, it was seen that there is highest COVID-19 rate was for household contacts of school-age children, but less for those children who were smaller, as said earlier. There has been a meta-analysis that is published this April, where they looked at various studies and they looked at contact tracing and population screening studies. The pooled odds ratio of getting infected contact in children compared with adults was 0.56, which means that children and kids younger than 20 years of age had a 44% lower odds of getting infection as compared to adults 20% 20 years or older. And this is especially seen in kids between 10 to 14 years of age. It definitely does not say that children are super spreaders. Now, Dr. Navi mentioned it very clearly, and the fact that children are super spreaders was derived from influenza. There has been no study anywhere in the last 1.5 years which has shown that children are super spreaders as far as COVID-19 is concerned. Just a minute, I have to take a call urgently. Just hold on. I'll continue. Yeah, sorry. Now, so that is the thing, that children are super spreaders is actually completely wrong. Okay, so we should not really bother about it. And why is that important to know? Because children getting into schools, and that is related to education, has been denied because of them being super spreaders. We'll come to that later in the slides later on. The epidemiology of children, COVID-19 in children, in terms of number of cases, only 2.2% of cases were 19 years or younger. And so the numbers that are there, admitted children in studies that have been done, is less. In our hospital, we have a medical college which is treating which has a bed strength of 400 COVID patients currently, which fluctuates from 350 to 410. And we have ICUs of probably around 250 odd ICU beds. But very few children are admitted in our hospital. They may get infected, but very few of them admitted. We have had 1 or 2 patients who are seriously ill, but we've not had a lot of them. So that is in sync with the data that you are seeing on the screen. Not a large number of patients, children are getting admitted. So if you see the line in green, children are vulnerable to family aggregated infection, but are unlikely to drive it. So this is again to put out the theory that children are super spreaders. Okay, and whenever a family gets infected, it is very unlikely that the child brought it home and gave it to the adults. It's usually the other way around. Adults brought it home and gave it to children. So that is something which we would want to say. This is again a report from Spain from last April, which few children were hospitalized and around 10% were admitted to PIC. This is a very small sample, so I would ask you to be careful. And no patients died. That's the most significant point that I would want to make. Incubation period for children is actually longer as compared to adults, so that is something we need to keep in mind. They may not become symptomatic for a long period of time and then develop symptoms later on. When you find that the child is RT-PCR positive, my kids are positive currently, and everyone is asking me whether they have any issues, but they have been positive following contact tracing, and they are not symptomatic. So they may not become symptomatic ever, or they may develop symptoms quite a bit later. Okay, and so that might be the reason why kids may not become symptomatic or become symptomatic later. And hence, we should be careful when looking at whether kids are not affected at all. This is the presentation. So cough, fever, diarrhea, vomiting. So diarrhea, vomiting is more frequently seen in this particular outbreak, and this is again based on what people are talking rather than any particular data. And fatigue and rhinorrhea and all of the symptoms that are there previously also continue to happen. But remember that cough and fever are the most significant findings which are there. Many children will be asymptomatic, and that is something which we should remember. So they may remain asymptomatic They may get COVID-19, they don't get any symptoms, and they may become free from COVID-19 without any treatment at all, like not even paracetamol. Why is it important? Remember, as was mentioned in the first talk, there's something called as MISC, which can happen post-COVID, 2 to 6 weeks later after COVID happens, which is a rare illness, pretty rare illness, but can be serious. It can be but is a serious illness and is treatable. We can have MISC developing in children, and they might have had a history of COVID-19, which was not at all detected because nobody thought of doing RT-PCR test, or they just put it out as some mild fever. Everyone knows this. I will skip this, but just remember that the prevalence of COVID-19 critical illness is lesser in children. Loss of smell does happen in children. The mild illness is more common in children. Severity is in 14% and critical can be in 5%. So this is among those babies, those patients who require admission. So case fatality rate is not the same as infection fatality rate, and so this is among children. Very few children have severe disease, less than 1%. I will skip this, but RT-PCR testing needs to be done regularly. Okay, I will skip this slide, but just remember, look at this slide. If you look at the black line over here, 1 week before that, children or anyone can become positive. You can see this blue line is an nasopharyngeal PCR test. For a good 5 to 7 days before you actually start showing symptoms, you can be RT-PCR positive. So if you get RT-PCR report, say on 21st or on 22nd, then maybe till 29th, you shouldn't worry whether you should not think that whether a patient is having symptoms or not. He or she might show symptoms on 29th of that particular month, and following that, you have to think that that person may be infected for another 10 days. So this is something that we need to remember. Okay, there's a lot of discussion on CT values. Be assured that CT values are not very important. There's a ICMR advisory says that we should not be talking about CT values. But unfortunately, everyone, including doctors, looks at CT values and say that there is increased viral load or low viral. Why we should not look at CT value? Depends upon from where, which part of the pharynx you are taken, what part of the disease stage you are taken, and so on and so forth. So we should not really worry about cycling threshold. Let's skip this slide and go next. So decline of infectivity beyond the first week of, once you start having symptoms beyond 1 week to 10 days, you're not going to be infected to others. So again, generally 10 days after having symptoms, you should not consider any patient being infected despite the RT-PCR being report positive or not, etc. Let's keep antigen testing. That's something which is what is called as a rapid test. It is quite good. So if it is positive, you should consider it positive. If it is negative, then you should follow it up with a RT-PCR test. I will skip this. A lot of lab tests being done in children. From the patients that I have managed who are COVID positive. So I have managed patients 4 months old, 9 months old, 1.5-year-old, 5-year-old, 7-year-old. So most of these patients that I managed are actually contacts. So their parents became positive, and then they did for the kid also, and they found that the kid is positive. And when the only drug that I have given this particular patients is paracetamol if they have had fever. Some patients have not received even paracetamol. Okay, so many people are doing drug polypharmacy, especially in adults. I would urge anyone not to use any of these drugs in children. They are not required, and there is definitely no pre-symptomatic treatment. So all of these things really don't matter. From whatever patients I have managed, they have maximum got paracetamol, nothing else. Okay, and I avoid doing investigations in them unless they are having some kind of serious illness. Not that we don't find serious illness in children. We do get. We have had patients in the ICU who are managed who have got remdesivir, but that's rare. That's not common. Okay, so these are the various investigations that you can do, but I would avoid. And CT scans definitely should not be done in children unless they are having breathlessness or some issues. Doing a CT scan to confirm whether pneumonia is there is harmful to the child. It exposes children to radiation, which can cause cancers later on in life. Okay, so this is something which is not discussed, unfortunately, and I think we should generally try and avoid CT scans. And this holds true for adults also, but for children, I would really never do a CT scan unless that person has, that child has distress or something like that. Okay, and so there is a note, you can see that the American College of Radiology does not recommend CT for screening or as a first line test for diagnosis of COVID-19. I will skip this, or maybe I'll just keep this. This is very few deaths in China. There is no prevention by drugs for COVID-19, either in adults or in children. So there is no pre-exposure prophylaxis and there is no post-exposure prophylaxis. So there are no drugs that can prevent COVID-19. I will skip this and I'll go to main parts, but most common, I would impress upon everyone that children, if they get it, they get mild and moderate symptoms. Now, coming to the discussion that has happened for the first 1.5 hours, whether more children are getting affected, and I would agree with Dr. Vivek, who said very clearly, based on data on less than 5 years old, that percentage of children that they're seeing has remained the same. So, in terms of percentages, we probably have not had more infections in children. The variants are probably more transmissible. That is what the general thinking is. Because they are more transmissible, we have had a severe caseload in adults, and because adults are getting infected and they have families with children, children also getting infected. So we have more number of children getting infected. So as a pediatrician, as a clinician seeing patients, in July last year or December or November last year, when we had increased number of patients in Gujarat, we did not see so many children. We saw children, not that we did not see children who got infected. We had children who got infected. But now we are seeing more children, and we are seeing more children just because there are more adults getting infected. That is not really rocket science. It's just that we are seeing more numbers of children. It is not that it is affecting children more. So that would be a very wrong statement to make unless we have data to back it up. And we really don't have any data to suggest that children as a percentage of the cases are getting more, are being more infected more. So I would suggest everyone to be very careful when using the term that more children are getting, the more children are getting affected is the numbers and it is not the percentages. So as far as percentages go, it probably is the same. So coming to the safety of children, so that really doesn't change much. Masking, hand washing, and social distancing remains the bane for even remains the basis for safety in children. There are different bodies giving different recommendations for usage of masks. Some bodies may recommend that children more than 2 years old should be having masks. Some bodies recommend more than 5 years. And it is up to you to use whatever recommendation that you want. Remember that masks are mainly for prevention of your infection going to another person. If everyone is masked, then the benefits of mask. I have to take this call again. Just hold on, please. So remember that the more number of people masking is better, so that virus transmission is reduced. And so if children less than 5 years of age don't wear masks, we should not be worried so much. If they're wearing a mask because they want to mimic adults, it is good. But there's no point in forcing it. You can't really force kids to do anything. So don't even think about it. Preferably use surgical masks. N95 are not designed for a fit for smaller faces. And so if it is a bigger child, then it's not a problem. But if it is a smaller child, then that N95 mask is not going to fit. But if you want to do something, then you can actually put an N95 mask on the child's face and put a cloth mask over the N95. That might ensure good fit. But good fit is important, and surgical masks are the best bet for, or double, or using 2 surgical masks are the best way to ensure that good fit for masking is there. The Prime Minister used to use cloth masks, and he recommended it earlier, and that was before data became available. But now, with availability of more data and availability of masks, especially surgical masks, it is recommended that everyone should preferably be wearing simple surgical masks. N95 are difficult to use. They are expensive and they are also a little bit uncomfortable. So as far as I am concerned, I generally use a surgical mask regularly. And if I know that I am going to be seeing a COVID-19 patient in the ward, etc., then I would switch over to an N95 mask. But in general practice in office or in regular OPD, I generally just use a simple surgical mask. Hand washing with soap and water and alcohol rubs. Children really love this because it is an activity based thing, and making sure that children learn how to wash hands is good. You can get them to make videos and share with the family so they feel involved. So it is important to ensure that the children are engaged throughout, and they take responsibility for their safety. Physical distancing can be difficult, and it's important that there is no need to distance physically within the family itself. It's important to distance when you're outside. Okay. We have had this issues with masking within the car, etc. But remember that if it is the same family member, it really is not going to be helpful, because you are going to be in the same space at home where there is aerosol transmission going to happen. Now, if a person becomes positive at home, now this is very important for safety of children, because if suppose an adult who is working, or like many of us who is a doctor, gets infected and comes home, then it is important to understand that that person needs to be isolated. So the infected person needs to be isolated in a house if it is possible, and many houses don't have so many rooms. Second thing is everyone in the house can wear masks. So it has been shown that if there is infected person in a house and is not severe enough required to be admitted, if everyone in the house starts wearing a mask, it has been seen that that infection does not get transmitted to others. Okay, we should remember that dining areas are areas where the mouth is open. So people who are infected should preferably be sitting in a single room and eating, and not interacting with other people. Air conditioning, or there needs to be air movement. So my office is not air conditioned, so I have not been using air conditioning for the 20 years of my life. So it really doesn't matter to me. But in places where there is air conditioning and where there are closed spaces, then you can transmit to others. So that's something which people would have to remember. And same goes for houses. So if in houses there is air conditioning, and if there is smaller spaces, then you are likely to transmit infection within that room. And what happens, it's not a question of within that room. The COVID-19 particles remain suspended in that air. And so if you come from outside, and if you don't know, and if you're not wearing a mask, you might inhale the virus. So that's something that you would want to be worried about, and ensure that you try and not use the air conditioning. It can be very difficult when the temperatures are 40 and 42 degrees centigrade to not use air conditioning. And if you can't afford it, then maybe it's a blessing in disguise. But so that's something that which everyone needs to consider for their own self. So physical distancing is important, and it's not like a 6 feet के बाद COVID virus नहीं पहुंचता. उसका limit 6 feet. It's like a continuum. It can happen at 7 feet also. It can happen at 4 feet also. So it depends. So the 6 feet is like a general guideline. Okay, so where we are next. The most important safety. So if you want your children to be safe, then you have to practice COVID appropriate behavior. So because as I showed you earlier in the few slides earlier, you can transmit, adults can transmit infection better to children, and children cannot transmit infection as much to adults. The simple reason is when you and I cough, we cough with a lot of power. Children are less likely to cough with that much power. Okay, it's very simply a function of muscle that we have as compared to the muscle that kids have. Okay, so if you want your children to be safe, ensure that you practice COVID appropriate behavior outside. And now when vaccination opens up, as we know from May 1st, vaccination will open up. If everyone who is eligible should get vaccinated, then that is one of the best practices not to get COVID within the family. Now, Dr. Naveen mentioned about vaccination preventing in transmission. Now, he said that in the US that there is data to suggest that if everyone got vaccinated, there will be no transmission of infection. So, which could be because of various reasons. One is you yourself will not get infected. That's one. And second, your transmission rates might be low. Studies, now this is based on epidemiological data. the vaccines are not designed to prevent you from transmission of the infection. Currently, all the vaccines that are available will prevent you from getting severe disease or definitely from dying of the disease. Okay, even the vaccines which are in India are supposed to prevent deaths if 1 month has passed after the vaccine. From what I saw on Twitter yesterday, there was some person who was less than 45 and has died, and there was a lot of noise that that person could have got the vaccine and would have survived. But that person was clarified later on that to have died of a non-COVID illness. So getting COVID and dying of a non-COVID illness can be two different things, and we should just not blame everything on COVID because COVID is in the air. So I don't think that we should be very careful about ascribing deaths to just only COVID. Now coming to safety of children with the variants. So Dr. Rajiv discussed a lot of variants. They often refer to them by the country names: British variant, South African variant, Brazilian variant. Now we have a double mutant and the triple mutant and God knows what, maybe quadruple mutant. Now, one thing about variants is the UK has done a very good job of sequencing variants. Almost 10% of all their PCR viruses are sequenced. Even the US does not do such a good job. The UK has a very coordinated plan to do sequencing. Sequencing is expensive. It's not possible. We don't have so many facilities. Gujarat has sequenced so far, I think, around 700 odd viruses. That's hardly anything. Okay, for the number of infections that we have, 700 odd is hardly anything. So we are really not sequencing enough. So till India sequences a large number of viruses, we will really not know how many variants are there. We are actually ignorant of the number of variants. So again, they might be highly transmissible. They would replace the current virus in play, and but there is no evidence to say that children are getting more infected. I discussed about why children are getting more children are there because more adults are getting infected, and the best way to prevent variants actually is to get a vaccination so infections don't occur, breaking transmission, and so variants occur when more replication of viruses happen. More replication viruses have happened when people get more infected, when more people get infected. And more people getting infected can be prevented by COVID appropriate behavior, which is masking, sanitizing, and distancing, and of course by vaccination. Coming to newborns and infants, they are not often considered. And why is that important? Because newborns also can get infected with COVID. When COVID came about last year, many of the people who got infected, mothers who got infected, were in their third trimester. But as COVID remains in our country, there are mothers who have got infected in second trimester and in first trimester. Now, the breastfeeding guidelines suggest that even if the mother is positive, we need to continue to breastfeed because the benefits of breastfeeding far outweigh the issues of getting infection in children. Skin-to-skin care for premature babies needs to be continued. This is again supported by WHO and other international bodies. Also, regular vaccinations need to be continued. Dr. Naveen mentioned about vaccination. In our zest to ensure that everyone gets the COVID vaccine, we should not ignore that regular vaccination of children should continue. Last year, because of the lockdown, etc., a lot of children got delayed vaccination, and we should definitely try and avoid that particular thing. So, safety of children from vaccination standpoint is particularly very important. Okay, now coming to a lot, I think Dr. Priyamda will discuss about mental health aspects, but when you talk about security, we also need to understand that, and when Dr. Dasgupta mentioned a story from Delhi about grandmother getting infected and no one to look after the baby. One of the major reasons while which will be an epidemic of various proportions when parents get infected and there's no one to look after children because we are nuclear families, the virus infects rapidly everyone. So we need to be careful. Okay, and if it is a nuclear family, then we have to have support systems. So support systems, developing support systems in your communities is particularly important. Okay, also constant exposure to negative news can cause fearful impact in children. They should be aware that it can be prevented. They need to, we can also use them as ambassadors for COVID appropriate behavior. Getting them masks and pointing towards the masks, or allowing them to make videos and share the videos is particularly useful. And now when I talked about I've looked after children who got COVID, many of the children were actually hospitalized along with their mothers or along with their parents. So the children was in the hospital because both the parents were admitted, and the child was just, there was no one to look after the child at home. And obviously, because it's a small family, the child would also have got infected. So it makes sense keeping the child in the hospital and getting care along with the parents. So this is something that we should kind of be talking about more. Now, the issue of educational concerns, and this is for school-going children, it has been a lost year in most parts of India. We do know that the 10th standard exams were cancelled and everyone got promoted to 11th standard. Learning has been definitely compromised. In theory, online learning is the same as in-person learning. You can have equal outcomes, but that is if you build for online learning. When I say build for online learning, I mean that the teachers know how to create an online curriculum, how to interact on the online platform with children, and how to deliver the content online to children, and how to assess them online. Now, all that is not known. Many of the teachers that I know are uncomfortable with online platforms. They had to rapidly learn using laptops or using online platforms. Many of us also learned rapidly how to use Zoom and WebEx, etc. Now, with all this being there, I can tell you quite surely that children did not learn equally well as they would have learned in person, unless the parents took special effort at home. And many parents did not have the luxury of sitting at home because they had to work during even COVID times. Even during lockdowns, many parents had to work, and they were not able to take care of their kids as far as education was concerned. So physical learning is important, but with the wave that we have currently, return to physical learning, I don't see it happening for the next 3-4 months at least. Okay, and so it's important to ensure that online learning is there. So there are the studies which have been published from the US. What it suggests, if you look at the last line, there's going to be a loss in life expectancy because of missed school. Why? Because in-person learning is better. Online learning will lead to, in long term, reduced educational attainment and lower life expectancy. And so this is something that we need to be cognizant of. So how do we open schools? Now, this is something that has to be thought of, and because children are asymptomatic, physical distancing, hand hygiene and masking, and preferably outdoor schools or improved ventilation are the only way that you can ensure that transmission will not happen in schools. Studies in the US, Germany, and other places have shown that when teachers got infected in school, more often than not, and this is based on studies, they have got infected out of school setting rather than within the school setting. So the fear that children might infect adults in school is not really proven by evidence. What is seen is that adults who come to school get infected in non-school settings more often than in school settings. So so if you look at the third line, this is from CDC. Out of 191 COVID-19 cases in staff and students, only 7 cases were supposed to happen in within school transmission. Now, again, remember, this is evidence from the US. Their schools are not the same as our schools. They have definitely more space as we have, and we should look at having our own policies for this. Okay. While in Israel, there was a outbreak that happened in May 2020, and this was because there was insufficient physical distancing. People are allowed not to use face masks, and air conditioning, recycled interior air within closed rooms during the heat wave to preserve electrical charges. So this is something that we need to understand. So you have to really form local guidelines. I will skip this. The American Academy of Pediatrics suggests that we need to go to physical schools as fast as possible. The Indian Academy of Pediatrics very well focused that we need to open schools as soon as possible. This was in November, December last year. And we need to revise curriculum and reduce curriculum and focus on revision. Very clearly, if you can see, now this depends upon good data. If there is good data in the district, and this is the very important point, if the data is accurate, if you know the exact amount of transmission that is happening in that particular district or in that particular taluka, if the case positivity rate is less than 5%, then you can start schools and you can actually open schools. And you have to have a preparatory phase and an implementing phase. Now, we really do know that the data that we have in many places is not really accurate. And so opening schools in the face of inaccurate data is not really a good way of managing things. I look at, because we really don't have good data that is available, I look at what happens in my hospital. We have a dedicated 150 beds or 200 beds that went up to 400 beds now for COVID-19 patients. So if I know that in my hospital there are less than 50 patients in COVID areas, then I know that there is not an epidemic going outside. Then I'm quite comfortable moving around, even traveling. I'm not really worried. But if I know that in my hospital the number of patients have crossed 100, I'm distinctly worried, and I know that there's something wrong that is going on. So I use data from my admissions in my hospital to understand what is happening in the world outside, because we really don't have access to good data. With children remaining at home, we need to have a routine at home. They need to participate in doing home work at home. Parents need to check school homework regularly. There needs to be open conversations addressing fear, drawing stories, etc. And we need to ensure that we increase our educational activities slowly over a period of time. Because they're exposed to online platforms, my children got mobile phones just last year because of this COVID pandemic. I was not planning to give them
Sir,
mobile for the next
sir,
5
sir,
years.
sir, sorry to disturb you. Kindly yeah, yes, sir.
Last two slides. We need to protect children online and stay in touch with children's educational facility. So this is the vaccines in India versus UK. You can see that India has barely vaccinated 1.3%. Now, if you look at Israel, when you put Israel in the mix, you can look at that 57% of Israel has fully vaccinated, while India has vaccinated just barely 1.4%. That means a large population in India is susceptible, and we can actually have the third wave of the pandemic too. While we are worried about the second wave, we need to be prepared for the third wave, because I don't think we can rapidly vaccinate as much as Israel has done. If you look at the first dose, India has reached 8.3%, which means a month later, India will be 8.3% fully vaccinated. Okay, but Israel is already at 62%. Why is Israel important? Because yesterday, after so many years, they have not had a single COVID death, which means that vaccination is very effective, and we need to get vaccinated pretty fast. Despite the concern for variants, I think all of us getting vaccinated faster would help prevent COVID deaths. This is my last slide. We need to consider lockdowns and societal measures, and testing, tracking, and tracing is important. The therapies that have been really proven to be effective are only corticosteroids and oxygen, and nothing much else. With that, I would like to thank everyone, and hopefully we should be. I'm available to answer any question not pertaining to all children only. Thank you very much. Yeah,
thank you so much, Professor Somshekhar. You have been very, very educative and inspiring, and you have actually given us a very strongly educative presentation. You have also dispelled a lot of assumptions and myths and removed the scare and unfounded fears. So thank you so much, and also especially about newborns and infants. Your practical advice is great. And the one word that I would like to say is how to become an ambassador for COVID appropriate behavior. Thank you very much, sir. I'm sure there will be questions, but thanks once again. And later on, I hope you will take the questions. Now it's my pleasure to introduce Dr. Sandhya Ramanathan. And from her profile, it's very evident she's a very celebrated personality and with a lot of experience. Recently, she has been given Top Infinity and Beyond Award as recent as 3rd of February. So congratulations, Dr. Sandhya. And employment history of Dr. Sandhya, she is now based in New Zealand, in Auckland, in Surrey Medical Center, and she has several years of expertise with postgraduate studies and fellow of the Royal New Zealand College of General Practitioners. So with such a celebrated career, and you have also lots of publications and presentations, I have little time to say all this, but later on I'm sure people will get to know you more. And I would now like to give you the platform to speak on preventive and protective measures. Very welcome, Dr. Sandhya.
Namaste, and thank you so much for having me. Am I able to share my screen now?
Yes, please.
रंजन जी मैम को प्रेजेंटर रोल दे दीजिए.
Presenter role already there account.
Okay.
Okay, perfect. Dr. Sanjay, you can do that.
And if you can just record it as a split screen.
The entire recorded, so don't be worried about it.
Okay, wonderful.
Yeah,
yes, we can see
perfectly.
You can see.
We can see
Okay.
your presentation.
Yes, well, I'm very honored to be invited today amongst this very esteemed panel in this very difficult hour that India is facing. And, you know, I'm sitting here in New Zealand and the whole world is watching, you know, the tragedy that is unfolding in India. And this talk, which has been kindly organized by National Institute of Disaster Management India, who I've had the pleasure of being affiliated with since, you know, last year, and UNICEF India, I think this is, you know, crucial because, you know, I've entitled my talk today, Preventative and Protective Measures to Mitigate Impact on Children and Families. And the reason I've entitled it Children and Families is because you cannot separate the child from the family. And currently, you know, the situation that we are seeing in India and in other places around the world where, you know, there is this second wave, you know, happening, and all the talk of now young people and children becoming affected. A lot of this is due to the fact that, you know, that we have actually, you know, been able to create vaccines against this virus, which is, you know, incredible, and something that, I mean, I think should be highlighted as a great deal of hope, because, you know, just 6 months ago, there was, you know, no, you know, definite expectation that, you know, we would actually be successful in achieving this. And so one of the things that's driving the fact that we're seeing now much more younger people getting infected is because obviously the older populations are being prioritized and they are getting vaccinated first. But of course, you know, in India, currently the situation of the, you know, the resurgence that we're seeing is pretty much due to two factors, and that is complacency and also the rise of these COVID variants. So, you know, my entire journey through the pandemic and why I'm a speaker here today is because very early on I realized that there was a lack of information that was being put out by authorities to empower lay people, you know, as to how to safely navigate the pandemic and to continue living and existing within the, you know, the new rules and the parameters. And so I became very active on social media, you know, reading extensively. But every article I would read, I was trying to look for the solution rather than focus on the problem. And to sort of, as a primary care physician, as a general practitioner, my role is, being an advocate for patients and promoting prevention. And in a pandemic, there is only one truth, and that is science. You can only follow science in a pandemic, and the resurgence in India is clear evidence that there is no role for politics in a pandemic. We need to, in order to control the pandemic, and this is an emergency situation, and it can be done, we need to go back to science. So my talk today is going to be very interactive and very practical, and I'm going to try and give you, practical tips that will help. I myself am a parent. I've got 2 children, a daughter who's 16 and a son who's 15, and it's, this is basically what I would do in the situation to make sure that I could, get through safely. So I liked Vivekji's analogy about, in a storm, which is currently what India is facing, don't try and calm the storm, try and calm yourself. Now, I agree that staying calm is paramount. And, funnily enough, when I was asked to do this presentation, just straight after, or just around that time, I saw this beautiful rainbow in my backyard. And I managed to take a video of it, and I actually posted it on Twitter. And I just wanted to remind everybody that, in the current scenario where there is so much chaos going on around us, it is very easy to just remain panicked. But it is very important that we all try and, focus our mind, take it away from the outer chaos, and move that energy and try and, create and focus on inner strength, empowering ourselves with knowledge and understanding how we can continue to live. Because basically, it is not the end of the world. Pandemics have happened before. They probably will happen again. This situation, this pandemic is a marathon. It's not a short-term sprint. So today, I want to go back to, and in the video which I recorded in June last year on how to manage mild COVID at home, the basic principles were that, it was my disaster management plan, basically, that given the worst case scenario where there is no cure, you need to do everything in your power to prevent this infection becoming worse. Because, when there is no cure, prevention is the cure. So, taking this, rainbow concept, I created, with the help of my cousin Aditi Jeswal in Canada, and I think it's very important. We talked about, one of the previous speakers talked about the importance of education of children, and this is crucial. You need to empower everyone in society with education, because only when you inform somebody as to how they can properly manage, will they be able to change their behavior. And it's the same thing, the reason of the success behind my video, I didn't simply prescribe a treatment. I first explained why, and then I demonstrated how. Now, using this rainbow concept, which I hope that you will take, what I was trying to convey is that, the children of India, we need to protect them. The children of the world, we need to protect them. So, basically, if I hold up this image, we can look at under the rainbow as being the protective bubble that we've got to keep children under. In order to get to the end of the pandemic, which is, that elusive pot of gold at the end of the pandemic, we don't know when it's going to be, but we have to protect our children and do everything in our power to protect the children. Now, in order to protect the children, the rays of the rainbow represent the layers of protection we have to apply. Now, in the UK, they came up with this, these words: hands, face, space, and replace. Now, when they talk about hands, they're talking about hand washing. When they talk about face, we're talking about wearing the mask. When we talk about space, we're talking about physical distancing while remaining socially connected. And we're talking about replace. We're talking about the importance of ventilation, because as Professor Santosh Kumar brought up, COVID is airborne. And one of the reasons behind this, resurgence with such vengeance is the, aerosolized spread of these highly infectious mutated strains of the virus. So, and overriding all of this prevention is the vaccination. And, and interestingly, I then learned that actually the name of the vaccination drive for India is Indradhanush. And so I thought that this image, would help people understand that, yes, there are many things that we need to do to protect children during this pandemic. Now, just to go back over, so I mentioned, there's a resurgence of COVID in India due to the complacency and the variants. Why has this happened? Basically, in fact, I might just stop sharing my screen because
Dr. Sandhya, it's perfectly perfect.
It's okay?
Yeah. Yeah, you have to go with the full screen only.
Okay. All right. Okay, I'll keep going. So as you can see in this image, in the green, we have pretty much what happened last year during the first wave of the pandemic in India. Initially, there was, a large, rise in the cases. Then we, had a lockdown, and, there was mandating of masks, and, there was a lot of collective measures. And then what happened, we, flattened the curve, and you had a good outcome. And now what we're seeing is, unfortunately, this scenario where basically, due to the complacency and no longer a concerted community effort, the cases have continued to rise, and we are now having collapse of healthcare systems. Now we can get back. India can get back to where it was just by applying those same rules of the behavioural vaccine. Which was going to be basically, our only way out of the pandemic anyway, until we actually developed many highly effective vaccines. And you have to understand that WHO would have approved any vaccine that was over 50% effective. We have vaccines, including the mRNA vaccines of the Pfizer and Moderna, which are over 95% effective. So, I mean, that is something, that is a great deal of hope that we need to hold on to. But as other speakers mentioned, it's going to take a long time to vaccinate the vast majority of the world's population. And the behavioral vaccine of washing hands, of watching distance, of wearing masks, and watching ventilation is here to stay for quite a long time. So why should I change my behavior? Well, the problem, I mean, people think, during this pandemic, there's really nothing that's in my control. But actually, there is one thing that's always in your control, and that is your behavior. Now, with the more transmissible strains, and, clearly they are more transmissible, we need to keep on following the same rules. But rather than just following the same rules, we have to actually improve what we were doing before. So when I'm talking about that, we have to improve the weapons we already had. So, our mask, which is still our #1 defense in, fighting, this pandemic. You've seen countries like France and Germany, in response to the more infectious strains, have spoken, have mandated premium masks because, they saw that that was an important way to contain the infection. And, all these precautions in terms of, ventilation measures is also extremely important. So in order to explain to everybody, what are the three factors that are, what are the three culprits basically responsible in this infection? there are only three. And one is the virus, one is the environment which we expose ourselves to, and the third is the host or the person getting infected, as in me. So I just want to talk about each of these and what we have in control, because this is very important in us understanding how to basically control the control the risk to us and navigate the pandemic safely. So in order to explain the virus, I'm just going to demonstrate using this, ball, which looks very much like the COVID virus particle. So basically, your virus is tiny. This is, you can have up to 10 million virus particles in one drop of seawater. So they're extremely small. And basically, your virus has a protein shell, and you have these little, spike proteins on the surface, and it has a fatty envelope. And on the inside, you have a piece of genetic material called RNA, and that is what the virus uses to replicate itself. Now, the reason we need to wash our hands for 20 seconds with soap and water is because by doing so, we destroy that fatty envelope, and in that way we destroy the virus and it can't infect us. Now, the virus alone cannot actually do anything to us because it can only replicate when we allow it access into our cells. And usually the portal of entry is through our mouth, our nose, and our eyes. And so what happens is when you allow this virus to enter your body, these little spike proteins attach to receptors called ACE2 receptors, which line the cells up of your upper respiratory tract and are also present in various different parts of your body. And one of the reasons why children don't, were relatively protected is they have less ACE2 receptors than adults do. Now, with the more transmissible strains, what's happening is these spike proteins are sticking a little bit better to those receptors, and people are having, higher viral loads, which means that the virus is transmitting more. I mean, this is basically the thought behind it. Now, these spike proteins, it's very important to understand that all the vaccinations are basically designed to reproduce this little spike protein and allow our body to recognize what this spike protein looks like, so that when we actually get exposed to the virus, our body can mount an immune response and fight off this virus. So if you want to understand, the little spike protein of the virus is like the license plate of the virus. And when you get a COVID vaccine, you are getting a small piece of genetic material. It doesn't contain any DNA. It cannot affect your genetic makeup. It is safe. It is just showing your body, this is what this spike protein looks like. This is what this L plate looks like. This is what you have to look out for. And then that little injection that you got disappears, and the body destroys it, and you are left with the memory of this license plate. Now, in terms of the mutations, although there is talk that some of the vaccines and possibly the one that's also being used in India, the AstraZeneca vaccine, is not as highly effective as, say, the mRNA vaccines, but they essentially are still working for your body to recognize the virus. Perhaps what you can imagine is with the mutation, part of the L might be missing. But by and large, vaccines are the best way and the only way to end this pandemic when the vast majority of the world's population, including children, get vaccinated. One of the great studies that just came out and it's great news that in Israel, that today was the first day they had no deaths, after a year, after their very successful, vaccination drive. And one of the effects they've noticed, because children over 16 are getting vaccinated in Israel, is that by the adults and people over 16 getting vaccinated, that the rate of infections of children are reducing significantly. So So, going back to, the rainbow picture, vaccination of family members, and particularly now when India is about to open up their vaccination to all adults over 18, is crucial to get vaccinated as soon as possible. So we know it enters through the upper respiratory tract and it can virtually go to any part of the body. So, I just wanted to explain again transmission. Now, in India, I mean, like when the COVID, started, basically the reproductive rate was thought to be 2 to 3. Okay, so basically you're looking that one person can infect 2 to 3 other people. All right. Now, with the more infectious strains, the nature of COVID, and this is why the COVID spread is exponential, because basically you get one person who infects another 2 or 3, those another 2 or 3 infect another 2 or 3, and so on and so forth until you have this exponential spread. Now, and that's why you're seeing this, rocket-like curve, happening in India at the moment, because the other nature of COVID-19 is that it tends to spread in clusters. So, weddings, functions, enclosed spaces where people are shouting and singing, and that is the nature of the spread. So, it is very important that we, stay at home as much as possible and cancel all functions, especially in the current context of, this emergency that India is facing. And, the responsibility lies with each individual, because as you can see, I mean, if one person does the right thing and stays home, so many lives can be saved through this exponential, spread and this graph. So, that's a very, very important thing for people to understand. So in terms of the virus, I mean, 6 months ago, I would have said that in that infection triangle, there wasn't really much that you can do to control the virus, but actually there is. Viruses can't mutate if you don't allow them to replicate. That is a basic fact that everybody has to understand. And so basically it is up to each individual to follow those rules of the behavioral vaccine and to break the chains of transmission. And secondly, we need to keep calm and get vaccinated. So there are two modifiable risk factors of the virus. We can stop it mutating, and we can, stop it having such, terrible toll by getting vaccinated, because, that is the best way that we can protect, ourselves and our families. Now, I mean, I just want to clarify this issue about herd immunity, which I think is part of the reason why India is facing, such a big resurgence, is that I think there was a belief in India that, perhaps, we could achieve herd immunity through natural infection. And the current upsurgence has proven that this is a fallacy. The only way in which herd immunity can be achieved is via vaccination of the vast majority of the population. So in this diagram, on the first, you can see that, before vaccination, you have, a few pink sheep that have immunity. And after vaccination, you have a lot more pink sheep, so that basically the infection can't spread. The pandemic will stop when one person infects less than one other person. And until that time, the pandemic will keep increasing. So the impact of mutations on herd immunity means that the more transmissible, the mutation, it means the higher the proportion of the population required to be vaccinated in order to achieve herd immunity. So again, I want to stress that we need to break the chains of transmission so that we stop this virus in its track. We do not allow it to further mutate, and we get vaccinated, if we are eligible, ASAP. Now, the second point I want to talk about is the environment. And the environment is impact. We're talking about, transmission routes of COVID-19. Now, initially, the main emphasis was on, droplet spread. And they're the big, droplets that we expel from our mouth when we, cough or sneeze. And that's why we had the whole, coughing into the elbow, which is still important. And also we had surface transmission. And early on in the pandemic, I made a video explaining how people could, make up disinfectant solutions in spray bottles. And you can see that on my YouTube and understand how to, get rid of any surface spread of the virus. Now, the actual most significant mode of transmission that's coming to light is aerosol spread. And I think this is playing a big role in India, because from all the stories that I'm hearing is that, even relatively healthy people are getting quite devastating effects on their lungs. And as you can see in this diagram, is that the aerosols, and to explain to you, I'm just going to demonstrate using a spray can. This is just a, Dettol Blend 20 spray. Aerosols are the fine particles that we emit when we are just even breathing or talking. So they look, you can imagine that it looks like smoke. So there's this sort of fine spray, okay? So what happens is that, these aerosol particles, if we inhale them, they can, obviously bypass our upper respiratory tract and go straight down, into our lungs. In an enclosed room, if a lot of people are talking for a prolonged duration of time, even if they are wearing masks, over time, these aerosols will increase in concentration in the room, and that will depend on the number of people speaking. So that is why there is no safe distance indoors when sharing indoor air with people outside your bubble. You need to minimize the time, and you need to make sure that the air in that room is getting replaced and refreshed by the introduction of fresh outdoor air, and that it's not a air-conditioned space with the air being recycled. So, and again, when we talk about environment, I just wanted to go back to the importance of our bubble. All right. So I've just got this snow globe to demonstrate that in order to protect, and kids remained quite protected during the first COVID wave, because the authorities were telling people that children were vulnerable, as were the elderly, and they were kept home and kept safe. Schools were closed. Now what's happened is kids have gone out, they've gone to school, they've gone to tuition, and they've been exposed. And in some cases, it's the children that are bringing back the infection. Children, thankfully, are not getting severely affected, but, family members are. So we have to go back to making sure that our house is a COVID safe bubble. That means when any adult comes, back into the house, or like particularly for dependent children under the age of, 5, or even you need to educate your older children who are independent that, they need to decontaminate properly, wash and sanitize, wash their hands, remove their soiled mask or any clothing and before they enter the house. Now, in the scenario where somebody in the house is infected with COVID, then you have to think, if I shake this bubble, you'll understand that those COVID aerosolized particles are now inside your house, okay? So if there is an infected person, it is, even if you suspect that somebody has COVID, because you may not be able to get a test, or the test may be unreliable. So if they are symptomatic, you've got to assume they have COVID, and they need to self-isolate away from other family members straight away. They need to be in a well-ventilated room with their own washroom, preferably. If they're using the toilet lid needs to be down, where they're flushing, because the plume of the aerosol from the flush can also create more COVID aerosols. And, we need to carefully wash the surfaces. So that's, just to explain to you in terms of the bubble and how it reverses if somebody in the family actually is also having COVID. The other thing is...
Sandhya, can we wind up in a couple of minutes?
Okay, all right.
Thank you.
Now, I just wanted to quickly talk about masking. Now, in terms of children, it's very important that, they wear well-fitted masks. Now, not everybody has access to a premium mask, but masking is absolutely key. As you can see in this diagram, an N95 will only work well if it's fitted well. So you need to wear masks properly, and the mask fit and filtration matters. So I just want to demonstrate a quick tip for improving the mask fit for a child. And I have this video on my YouTube as well. You just take the knots, the loops, and you put a knot at the end of the loops on either side. Folding it, obviously knowing that the blue side is the waterproof layer, the colored side. Okay, and this is good for anybody with a small face, and your mask is going to look something like this. Then you need to tuck in the edges. You need to put it on your nose and your mouth, and then you just need to tuck in those folds. And see how this has changed the shape of this simple surgical mask into more of a duck shape, like what an N95 mask has. And it has got rid of these big air leaks that otherwise would be there for children and for adults with smaller faces. And this is essential because, we need to protect, ourselves. And the other thing is eye protection is very important, okay? Because again, it is a portal of entry and we need to try and reduce the viral load. Same holds for children that are old enough to do it. Now, just quickly on ventilation measures, this is a very good chart which basically shows that you need to have, the air needs to be fresh, you can filter it, and it should be flowing. And you can use things like fans at windows to try and direct the air. You should make sure that you're not trying to propel somebody's aerosol towards another. Another very useful thing that Professor Kumar, you were asking about whether it was safe to be outside. It is safe to be outside generally, except that, if you can maintain a physical distance outside, then it's fine, because there is dilution in the atmosphere. And so they have these things called CO2 monitors. And there's a very good table which basically, I'll share these resources with you, where you're aiming, where you can measure what the CO2 is, and that can basically tell you how well ventilated that space is. And you're trying to aim for a CO2 reading of less than 800. To reduce risk, you need to have a well-fitted mask, you need to keep your distance, you need to avoid crowded places, and you need to reduce the duration of time where you are in enclosed spaces. But generally speaking, outdoors is okay, so that's very important. Now, in terms of just if you think you have COVID, as I said, I have got that video which I suggest that you watch. Stay home, self-isolated, get medical advice early in the household. Everybody, including if the child can't wear a mask, then the person assigned to looking after the child that's infected should be wearing a mask. Have your home disaster management plan ready. So all the things that I suggest in my COVID home management video, you can make up a little disaster management kit of your own, and keep everything ready and available so that that is something that you can do. My video is available in most of the regional languages of India, and all of the things, there is no pharmaceutical or medical intervention that I suggest. They're all very simple exercises that even a child can follow. But one very important thing, the most important thing for protecting children is back to the basics of, making sure that, that we are looking after their general health. And that also includes their mental well-being, because that's the most important thing for their immunity. So, your healthy lifestyle in terms of, eating and sleeping well, in terms of avoiding vitamin D deficiency, in terms of keeping up with your childhood vaccinations are extremely, extremely important. I do think that simple techniques that would be good and make sense is that when anybody returns from the house, just rinsing your mouth with some warm salty water and getting a simple, saline spray and spraying it up your nose, and then actually using a physical brush and brushing your tongue is useful, practical things that you can do, because a lot of these receptors are in your upper respiratory tract, and because they are accessible, diluting any viral load will help, and it won't cause harm. And it's something, everybody feels like they want to be doing something, and this is something that you can do which will help. Again, if a child is infected, generally speaking, they are going to make, a recovery without requiring any other medications than simply Panadol. But there is no harm in getting the child to do preventive things, such as, breathing exercises. I have great ones of balloon blowing, blowing bubbles into a cup through a straw, which is great fun for children and is a good way for them to make sure that their lungs are, remaining protected. And of course, you can keep an eye on their oxygen saturations with your pulse oximeter. The other thing I wanted to briefly mention, and it's extremely important, is, this proning. We're talking not just young children, we're talking older children. There is no room for complacency. I, as a parent, if my child was infected, I would do everything in my power to make sure that that mild infection did not become severe. These are simple things. These poses help improve the oxygenation of the lungs. You can put a pillow under the child's chest. You can give them a little iPad which they can look at, and they can sit in these poses comfortably. You can get things like, triangle pillow, and just make it fun for the child, and keep their anxiety levels down. So yeah, just in summary, basically, the behavioral social vaccine for COVID-19 is highly effective, and that is, we need to wash our hands, amen, avoid touching our eyes, our nose, and our mouth. We need to watch our distance. We need to wear a well-fitted mask that covers our nose and mouth, and preferably wear eye protection, and we need to watch the ventilation carefully. And basically, we just need to stay calm, carry on with the precautions while we, wait for the entire population, vast majority of the population, to get immunized. And as I said, hands, face, space, replace, vaccinate, protect our children, and let's get to the end of this pandemic, as safely as we possibly can.
Thank you very much, Dr. Sandha. Thanks a lot. We were just extremely wonderful the presentation, the way you did the practicals over the screen, and that will be much more helpful for all our audience here. And Kajrila sir, just passing out the time.
Sure. Thank you. Thank you. Very practical and very insightful, Dr. Sandhya. I would like to now introduce Ms. Pooja Priyamvada. She's a mental health professional and gender empowerment advocate. So she's an author, a columnist, a professional translator, online content and social media consultant. She is also a bilingual blogger, formerly also a radio announcer and lecturer. She offers psychosocial and mental health first aid in India and has experience of participating and mentoring several peer support groups working in the psychosocial space. She has an MPhil in English from Punjab and speaks vociferously about issues of gender, identity, and marginalization at a wider society platforms and medium. She has trained MBBS students in UCMS Delhi for disability competencies using poetry. Her areas of work are mental health, disability activism, sexual wellness, gender and marginalization, and favorite medium remains poetry and theater. A single parent, and she believes that she derives her strength from being a voracious reader and a tea connoisseur. Over to you, Pooja Priyamvadaji.
Thank you, everyone. Thank you for being so patient with such a long workshop. Thank you for the introduction. So I will straight away dive into the presentation. I know we are already, going over time, so I will just dive into the presentation. I will start sharing my screen. Please, somebody let me know if you can see my screen. Okay. So here we are. And yeah, so is my screen visible now?
Exactly. All right, Pooja, go ahead.
Okay, so I will be talking about mental psychosocial health today. In 1885, Frederick Douglass had said famously that it is easier to build strong children than to repair broken men. Now, 150 years later, we must focus again on building strong children. And when I say strong, I mean resilience in every way. We have heard a lot about physical resilience, and several colleagues have mentioned about psychosocial resilience as well. So I will be dealing with all of that in the slides to come. Now, what does it mean to be mentally healthy during childhood? It has some, general factors. One is reaching your developmental and emotional milestones, learning healthy social skills, and also how to cope up when there is a hurdle in any sphere of life. Mentally healthy children have a positive quality of life. They can function well in all kinds of setups, homes, schools, and in communities. Now, what has happened with the pandemic is that it has led to unprecedented adjustments on part of our children. They are required to adjust in terms of, online schooling, being in confined locations, restricted access to family and friends, and also at times, the overall grief that is happening all over also has a huge bearing on children. So we have to look at all of these factors, and then I will mention suicide also, because we are also witnessing a lot of suicide from non-adults during this period. So what are the factors and all, but there is no audiovisual content. If anybody feels triggered, please, you can step out or switch off. So
would you like to do full screen for your presentation? Can you click on full screen?
Yeah, just a moment. Yeah, is that better now?
Yeah, now it's full screen, Pooja. Go ahead.
So now the UNICEF itself has done several studies, and of course these are ongoing, and they have said that it is a universal crisis, and so much so that the effect on children, psychosocially at least, will be lifelong. And I know a lot of my friends have listed so many effective techniques for our mental health, for our physical health. But the fact remains that approximately 150 million children now additional children will get into multi-dimensional poverty. Now, when that happens, their access to education is taken away, healthcare is taken away, which also includes psychosocial healthcare. Housing is taken away, nutrition is taken away. They do not even have basics like, toilets or clean water. Now, in such a situation, when we tell them about precautions, then it becomes a kind of a platitude, a child who does not have access to all these basic resources will find this kind of a pandemic situation hugely triggering and hugely stressful. Now, what are those factors? Some of the factors that will directly affect their psychosocial health. One is when they're directly involved with this emergency, which most of the children are, if not all. Then those children who have had a previously traumatic or stressful event, of course, it will be more triggering for them. Then children, of course, are scared seeing news around them, seeing people unwell around them, fears of losing a family member, losing a pet. Then there is separation from caregivers, as Vivek ji and others pointed out, that sometimes the adults in the family get COVID and then they have to be isolated or hospitalized. In that case also, it has a huge bearing on the mental health of the child. Also, how parents and caregivers are responding. Now, a lot of adults themselves are going through a lot of pandemic anxiety. Yes, that is a term now in our psychosocial circles. We are calling it the pandemic anxiety. So when the adults are going through this, somehow the children, it gets passed on to the children. Family resources, as we know that economies are shrinking, so resources in every which way are shrinking, and that also has a huge bearing. Relationships in terms of communication amongst family members, amongst extended family, extended support groups, all of that is being affected. And then media coverage. A lot of that is quite helpful for children, but we must also admit that a lot of what our media is showing is insensitive, and it does affect children very adversely. Also, ongoing stress is also there because familiar routines have been taken away from children. Children are, if I should say, they are people of routine. They love routines. They love timetables. They love lists. So all that is being taken away because of the uncertainty. And community resilience also is all-time low. So all of this is affecting our children. Now, one major factor, as so many of you mentioned, is school closures. If you see there, almost the entire world is affected by school closures. Now, why are school closures so crucial? Because it is not only about learning loss or our children dropping out. Now, again, in that, gender is a factor. There are other socio-cultural factors that come into play. But it is a kind of social and emotional disruption for children. They're normal. A normal for, say, a children from aged 3 plus to about 18 plus is schooling, is education. And that is being taken away from them in some form or the other, partly or fully. And that is leading to social isolation, that is leading to anxiety. Then also their milestones are being taken away. Now, recently, somebody mentioned that the board exams were cancelled. For class 12, they are still in India, they are postponed, so we don't know. So there is that uncertainty, and a lot of children are under huge stress because of that. Also, a few studies amongst teachers have shown that this kind of uncertainty has also reduced academic motivation. I will try to keep it bilingual because the slides are in English. तो जब बच्चों को पता ही नहीं है कि क्या पढ़ना है, कब पढ़ना है, एग्जाम कब होगा, होगा भी या नहीं, स्कूल कभी खुलेंगे या नहीं, कुछ बच्चों के लिए दिस वाज देयर फर्स्ट स्कूल ईयर, पहला साल था स्कूल का, राइट? तो वो पहला साल उनका ले लिया गया है, और उन बच्चों को, छोटे बच्चों को लग रहा है यही स्कूल होता है, स्क्रीन पे एक टीचर आती है, यही स्कूल है. एंड वेयर एज द अदर एक्सट्रीम क्लास 12, उनको उनके लिए ये बड़ा डिस्टर्बिंग है कि ये नॉर्मल नहीं है, बोर्ड एग्जाम्स ऐसे नहीं होते, दिस डिडंट हैव टू बी माय लास्ट ईयर इन स्कूल. So school closures are not only about the learning gap or even the digital gap where the children do not even have access to any kind of online education. It is also about their psychosocial gap. For a lot of children, school is the only safe space they have. Children coming from homes with domestic violence or other kind of issues, and that is being taken away from them. So that is also another kind of tragedy that we've seen unfolding. Now, this was recently a survey done by Shakti Shalini. They work with women, but this was done in Delhi. And if you go by the reference, and why I have just put focus on education, that when schools are taken away, it does not affect only the learning or the education. It is leading the children into a kind of hopelessness, a kind of lack of any kind of hope or any kind of reassurance that will help them in coming over it. So when the families lack resources, a lot of these children then, as we had discussed a few weeks ago at NIDM, and I think that video is there on YouTube, a lot of these children, when they fall out of the school, they get pushed into other kinds of oppression, such as trafficking, such as child labor, which again is another kind of mental health crisis. So it is all connected. And I believe, as a lot of people said, and in the beginning, Mr. Singh had pointed out, optimism is a good thing, but we'll also need to keep looking at the larger picture and all the aspects together. Now, this is indicative, and this is also again from UNICEF. So the children who are falling out of NEET, which is they are not in education, they're not in employment training, so they have just fallen out of the system, and most of them are girls. Now, we already know in India, girls as it is are disadvantaged. If the family will be able to afford one device or maybe one paid vaccine, they will give it to the boy, and not the girl. So we know that girls are already disadvantaged, and when schools are taken away, when these systems are taken away, and when all our systems are under such immense pressure, it is the last person in the queue, which is sadly our girls, our girl children. They are the worst affected, and their mental health, I think, is not being taken up anywhere. In March 2021, UNICEF unveiled the pandemic classrooms at United Nations headquarters to call attention to the need of government to prioritize the reopening of schools. So even the UNICEF realizes that reopening of schools is so crucial for not just education, but for the overall well-being of our children, and how it needs to be done. All governments and policymakers need to collaborate on that. This again, if you see children, this has come up time and again in all our discussions with UNICEF, with UN, that there is a lot of fear and anxiety among children. And the only way to alleviate is that when they have some kind of peer interaction, when their safe spaces like schools or their daycare centers or where they play together, their playgrounds, their parks, when those spaces open, children find a lot of solace in humanitarian emergencies when these kind of communities open up. So we also have to look up, if we need to reduce the psychosocial health crisis, we have to look up for options where children can get together. If not in closed spaces, then maybe open spaces with safety, but children need this interaction. If they are not getting it, it is not good for their mental health. Now, how are children and adults different? लोगों को लगता है सेम ही होगा, सेम ही तरह से प्रोसेस होता है इंफॉर्मेशन, बट दैट इज नॉट ट्रू. बच्चों को एक रूटीन की आदत होती है, उनको जो उनके कंट्रोल में चीजें जब तक रहती हैं, उनको एक सेंस ऑफ सिक्योरिटी मिलती है. This pandemic has taken that away, has taken all of that away. Of course, age के हिसाब से how our children understand the pandemic, how they understand the security measures is also different. And that's why when they don't make sense of a situation fully, it is more scary. And also, children do not have any experience. In fact, a lot of adults who are here, who are alive, this is the first situation of its kind for us also. So imagine children who have had no exposure to any other disaster, and suddenly they are witnessing this, how traumatic this is going to be for them. Trauma, again, is a key word in mental health, and I'll be taking it up later. Now, what all is affecting our children's mental health? There's a lot of factors, of course, as I mentioned, their age, of course, what kind of needs they have. Sometimes children with disabilities, various kinds of disabilities, physical as well as learning or developmental, will have specific challenges. Also, the socioeconomic disparities have a huge role to play there. And because as Dr. just said in her presentation, it has to be children and family. Children are not an island, they do not survive in isolation. So what is happening to the families is also directly or indirectly affecting children. And when I say children, I mean even infants. So it has to be family and children. Now, what are the long-term impacts of isolation and trauma? They are huge. The physical health crisis is just one aspect of it. But the mental health crisis, they say, will be ongoing and will have more long-term effects of this entire trauma. In fact, several studies now say, some of them on Lancet and some of them on other platforms, that sometimes this kind of extreme social isolation and loneliness can have impact on children up to a decade. So up to a decade, there could be manifestations in terms of depression or anxiety. And hence, the loneliness or the isolation that our young people are facing needs to be addressed immediately. Also, screens. We must focus on bridging the digital gap. That is very, very important. Access to information and education is very, very important. But are the screens healthy? Our children are restricted to a screen. They are fitted into these 12 inches, 5 inches, 8 inches boxes. And again, this is leading to all kinds of anxiety, which comes from too much use of screens, or a huge influx of information that is coming to them and they can't process. And also physical health is deteriorating in many ways, posture related, eyesight related. Children can't sleep, so they are having sleep related issues. All of that can also be traced back to this increased use of screens. I don't remember, but somebody said that we were literally forced to buy mobile phones for our children because that was the only option left. So the screens again are not doing too well for the mental health of our children. Now, if you see the suicide data there, in 2016 we were on top in terms of teenage suicides in Asia. Right now, the data is not available for Asia, the latest data, but I am sure we are still somewhere on the top of that graph. And we must understand that when we talk suicide, it is not a mental health issue. You'll be surprised to know that as big as 65% of suicides, especially amongst teenagers, are impulsive. So there is no mental illness there, or they are driven by an immediate social crisis. For instance, at the beginning of the pandemic last year, we saw a lot of suicides in Kerala happened because the children felt left out. They had no access to online education. So there was no history of a mental illness. It was just, driven by the socio-economic factors at that point of time. So we need to understand that for teenagers, especially, suicide is a public health issue. And of course, it is a public health issue for everybody else. But for teenagers, often it is not a mental illness or mental health related issue. It derives a lot of it from socioeconomic issues. Now, somebody was saying we should stay positive and be positive and talk positive. Yes, that is important. Optimism is good if you can maintain it. But there is a lot of toxic positivity also that is affecting our children. We are seeing a lot of influx of messages where we say, be positive. Everybody else is suffering. You're not the only one. Look at people who have less than you. Now, sometimes what that does, it is the minimization of that child's experience. And when especially an adult says that to a child, the child feels that what I am experiencing is not valid. Especially in suicide prevention cases, we've seen that when the adults around the children, whether they are parents or they are teachers or anybody else, or even somebody, a helpline they called, if they invalidate the child's feeling, if they tell the child कि तुमको ये ऐसा क्यों लग रहा है, ऐसा तो लगना नहीं चाहिए, when you say that, the next time the child will not reach out, will not even tell, will not even share. So these kind of platitudes that we often use, and they become, they become bad for the child's mental health. So they are counterproductive. Now, encouraging children to be positive can sometimes tell them that if you're feeling down, if you're feeling sad, then that is not good. That is abnormal. That is not a good thing, and you should not share it with me. So then children often withdraw from sharing their distress, and this can be hugely detrimental when we talk about suicide prevention. We cannot keep telling children constantly that, look at the bright side, look at the bright side. We have to see, as you see in the graphic there, we have to see what kind of media they are consuming. We have to be there to process it for them. We have to tell them practical things that, okay, these are the facts about the illness and this is how we will go about it. And also we need to spend corona-free time with children. This is very, very important for classrooms, for families. Somehow everything has become about corona. What we are eating, how we are sleeping, how we are speaking, what we are seeing, everything has become about corona. Especially for children, it is important, whether it's 15 minutes, 30 minutes, whatever you can do every day, it is important that you do spend some corona-free time with your children. Also, resilience and strength. We always say that children, they imitate our behavior. So it is okay if I feel like sitting down and saying I'm overwhelmed today, or I'm too tired with my work, or I'm feeling sad about something. It is okay to express to children that it is all right to have those feelings, but we will have a safety plan. We will know how to bounce back. We will know how to reach out for help if this gets the better of us. So developing capacities in children as well as adults, this has to be done not during an emergency like we are doing right now. It had to be done before an emergency. this needs to be continued after an emergency, especially in terms of psychosocial health. So, what needs to be done, that the policies that we have, for instance, in India, all of us in the mental health activism space are now pressing on the government to have a suicide prevention policy, to have a suicide specific hotline or a helpline. So those things need to be an ongoing process. It cannot be just for the pandemic or just before the disaster strikes. It has to be an ongoing responsibility for everybody. And there has to be some kind of connection and coordination between various agencies to do so. And in this, we need not forget the other intersecting margins that I mentioned briefly. One huge margin, of course, is disabilities. Then, of course, the socioeconomic factors and gender. So children who are in those margins also need to be integrated into whatever developing of capacities we are doing throughout this time of crisis. That is very, very important. Now, you see this slide. इसमें कुछ बच्चों के कमेंट्स हैं. ये एक स्टडी हुई बच्चों के साथ, यंग पीपल्स वॉइसेस. बच्चों से पूछा गया, अपनी फीलिंग्स बताइए, आपको क्या आपको लगता है, हाउ कैन यू हेल्प. So we must not also forget that children, especially particular age group, pre-teens and teenagers, किसी ने अभी कहा बार-बार कि children can make videos and show others that they are washing their hands, they are taking care. Similarly, if you see there the highlighted word, I don't feel good, everything is soft, stressed, depressed. Now, वो feelings बच्चों की हैं और हमें validate करनी है. We don't need to negate them. But also we need to focus on the second half. Kids can contribute to awareness, to staying safe, to becoming influencers and raising awareness, and also to sensitize adults. Now, this here we need to take a leaf from the, I think, the advertising industry. If you see all ads, it is the child making the final. Most of the ads, the child makes the final decision. हम कौन सा jam खाएंगे, हम कौन सा biscuit खरीदेंगे. I think children now do have a lot of say in decision making in families. Though I know again this comes with a privilege. So we have to understand that children need to be integrated in decision making in whatever our action plan is as a family. I am facing some disturbance.
Pooja,
Yeah.
there is no disturbance. Your voice is quite clear, but extremely sorry that time we have to.
Yeah, I'll just take 2 minutes and I'll wind this up.
Yeah.
Okay.
Yeah, please.
So if you see the image there, you see a flower which is growing in a very extreme kind of situation. Now, some children can have that resilience naturally and thrive, but all children will not have that kind of resilience. So those children who are low on resilience need extra support from all of us, so that as communities and as all stakeholders we pitch in. Now that picture I had specifically put because if you see इस फोटो को अगर आप देखेंगे तो I'm sure कि जो frontline workers भी हैं तो पहला impression उनका ये होता है maybe he needs food, shelter, cleaning, उसको कोई चोट तो नहीं लगी है, उसके घर वाले कहाँ हैं. Mental health के बारे में हम सबसे last में सोचते हैं. And I think all the people who are in some way or the other involved with children also need to understand that the mental health of children needs to be right up there with all the physical interventions or first triage that happens when a children is part of a disaster. We need to also assess their mental health and also work towards providing whatever resources we have at our disposal so that the children also get some kind of psychosocial support along with all the physical support that is obviously needed. Now, you see, as I was saying here, that there is already a 10 years delay when young people first time experience a distress and then they get help. A decade. So imagine how big that is. And children, if we want to put children at the center of whatever we are doing, these are the circles. All the circles will have to come in. The immediate family, then the neighborhood friends, and then the other places that they go to like schools or clubs. And then finally, we, the outer circle, where we are talking about policy and implementation and what needs to be done and what probably needs to be done better. So all these circles, all this micro meso ecosystem needs to come together if we need to mitigate the psychosocial disaster that children are standing in the face of. And this slide I use in most of my presentations, and because it is my favorite, I seriously believe we are borrowing this life and this earth from our children, and hence we owe it to them that we take care of their mental health. These are two resources. Somebody mentioned Childline earlier, and there is another resource by Arpan. So if a child is in distress, please reach out. My email ID is there. I wish that all children do get the necessary psychosocial support along with all kinds of other support that might be needed in such a situation. So
Thank you.
thank you
Thank
so
you
much.
very much.
Yeah.
Thank you
I'm
very much. As always, excellent understanding the timing concerns and a very important, very important topic. And your topic is always that I invite you at the last of the session. That's my limitations actually, and you always do the justice with your topic. Without taking any time, sir, कंसिला सर टाइम हम लोग ऑलरेडी क्रॉस कर चुके हैं. मैं आपको रिक्वेस्ट कर रहा हूं कि प्रोफेसर संतोष को बुलाइए फॉर फाइनल आउटकम ऑफ द वर्कशॉप. सर.
Okay, so Mr. Santosh ji, we are very sorry that this has to be closed short. We have one more presenter, but we would like to hear from Mr. Santosh ji the final remarks. Yeah.
नेक्स्ट प्रेजेंटर जो है उनके फैमिली में कुछ कोविड का कुछ प्रॉब्लम हो गया, सो ही विल बी us today. So now we are concluding session, and Professor Santosh will be the best person to provide with the outcome.
I think Mr. Kem Singh is there, no? I believe.
Sir, Kem Singh, sir, after you, we will invite Kem Singh, sir, for the concluding remarks. So outcome of the workshop from your side, and after that we will be inviting Kem, sir, for the conclusive remarks, actually.
And Dr. Somsekhar is also there.
Sir, we will be taking all the questions. We have received a lot of questions, but time is not permitting us, actually.
Right. I will not say much here because it was very. I was delighted to listen to everyone. How I can have confidence and remove this and saying this, that what kind of an environment in which you can have this mask on, and in what kind of an environment you be free with the mask. So I'm now inside and taking all the protocol. So that is to be remembered by everyone, that when to put mask, and everybody has emphasized on mask. Everybody has emphasized on this tracking and also testing, and the kind of things which are happening amongst the children. Has already highlighted, and how to take protections, and how to go for this vaccination, and also go for the testing. Importantly, after listening to all the eminent speakers, I will not say much, 2-3 points. One, that despite this much of desperation and this anxiety all over, we still find some hope, and that hope on which we have to work upon. So this is the one important message which all the doctors have given, and saying that instead of panicking with the situation, we should build our strength within, and similarly we can have a partnership and also much more cooperative mechanism. So this is the second point which has emerged for fighting such kind of a situation. Third point also came at that we should treat this as a war, and in war we should not be critic to X or Y or Z decisions, but look forward, and we will see later that where went wrong. But idea is to correct immediately and move on. So that is important thing to work upon. And in this particular workshop itself, what we see that we have a large number of delegates attending, more than 400, and now even 350. And the range of speakers which we had from India to outside India, and from psychosocial care to the practicing this doctor. And all have advised that how children could be protected at this point of time. And the last message which Pooja gave, that it's not that we have inherited, but we have borrowed from the children where we are living. Important is that in this scenario, large number of organizations are there, and 109 have been highlighted by everyone. And whether this 109 will work, 98 will work pan-India, or can this also be disseminated? And also, like many of the people keep writing to NIDM and to us all on the individual mails, can this message be also forwarded to all the panelists at times when they are into desperation? And your advice probably would be helpful. I know that you are already under stress with the thousands and millions of kind of calls and attending patients, but that would give strength when such kind of open for you have given. I could see Dr. Somsekhar also gave a kind of email and his pediatrician platform, that how that can help everyone and whosoever in the need. Many of the states are also writing and for different kind of advices. And this eminent panelists have come up with larger solutions. So these solutions which our center can actually filter it out, that it's at the policy level and I at the people's level. So both will go together. And we would like to share with our administrators or the people are in position, those who are taking decisions. And definitely we would be Shri Kem is also there, PPA Foundation is there always to support NIDM's endeavor. And at his level also, he's been connected to many people who are working at the policy level. The children's voices and the recommendations made today could be heard by different. Yeah, we can also share this with the National Disaster Authority and also with the Ministry of Home Affairs, the suggestions which have come up. As Dr. Somsekhar and also Dr. Vijay and Rajiv Saab and Dr. All are expecting different levels. So I'm sure that that recommendations given by this would be very good. And I would request Dr. Rakesh to kindly pen down all these points. Like changes, like situation. We have to work in a commander like then we have to have a disaster plan to what Dr. Naveen was telling into that how we would be and also that stakeholders, the policy level, but all that stakeholders' consent to be brought into the policy level, and probably the exact forum we can think of. And many of the panelists, what we can say, even if there is no webinar, support the community into this. So we have a kind of resources to share. So videos there and everybody. It's a request, please, your mic. Don't go for testing. Somebody said that you should be home quarantine, and others are suggesting that you should immediately get into touch with the doctor. So WhatsApp or social media is also creating another distress. So this kind of a forum and the suggestions which have been brought in would be very, very useful. We can give this as kind of a, before we send it out to different forums, today's recommendation, I would suggest, Dr. Raka, that could, the points can be vetted out by all the panelists, that these are the things which we wish to share with the policy people and also to the common platform. So with this, I would close, and from my side, and I would be I'm extremely grateful to all the panelists and the resource persons and the participants who have joined together in a very tough time, difficult time. And in this difficult time, we have got a very, very valuable suggestions from all the panelists. So I'm grateful to all of you and Dr. Raka, Dr. Balu, and Ranjan Kumar for organizing this with the PPA Foundation, and Mr. Ray. I'm giving you additional responsibility with CCDRR that how we can bring it out in one pager or two pager note of the today's deliberations. But otherwise, what will happen? We will remain in the circle of concern. We will not move on to the circle of concern to the circle of influence. And here we need to move out from the circle of concern to the circle of influence. So,
yes,
and
Dr. Santosh, I have already noted some points, and I will be happy to work with you on that.
Yes, and that could be vetted out by all the panelists also. And we will immediately, that will give strength those who are affected and those who are likely to be affected, because nobody is likely to be affected. So take care of yourself at the personal level also what have been suggested, and also to our community, friends and relatives, we would be sharing. And once again, I wish to thank all of you. And Dr. Taka, I am sure that you will be giving formal vote of thanks to each and every individual.
Thank you very much, sir. Thank you.
I would just like to salute from NIDM side to all the distinguished panelists along with Sri KMC. Thank you very much.
Thank you very much, sir. Thanks a lot. You just given us the directions what to do next after this workshop, and what were the outcomes of actually the workshop. And sir, let me tell you that all the panelists are still here, and we have received a lot of questions, but we are not, because of time constraint, we are not able to take up the questions. So if you kindly allow me, before inviting KM sir for the final concluding remarks, if the panelists themselves are looking at some certain very valuable questions and they can come up with the answers on their own, so we should go forward with
final words from them.
Yeah, exactly, sir.
As a
so thank you very much, sir.
Panelists to say the final words from them.
Yeah. So Rajiv sir, Naveen sir, everyone is here. Somsekhar sir, Dr. Sandhya, Pooja ma'am. See, this is not the time to that I go through the questions and ask you. So final words from you one by one, please.
No, nothing from me. Thank you. I really learned a lot from the other panelists. Thank you.
Thank you very much, Rajiv sir. Thank you very much.
Yeah, so yes, we are in a very catastrophic position, but we should not have complacent, but also not be totally, panic. Children are getting affected, but still it's a mild disease. The number is so high, and most of these can be managed at home. Vaccine more time, not very long, but definitely we should start planning and do a good job with the communicating, and first see that adults get vaccinated, and we have to make that successful, and we have to be very, very careful about the misinformation and the say WhatsApp University and all this, and should not become a party to as a multiplier to the misinformation. That's definitely doing more damage than the pandemic itself.
Exactly,
And
sir.
we have to be united. Thank you.
Yeah, thank you very much, sir. Well received, and I hope that participants just received the message and they will be disseminating it to the further masses. And next one, please, whoever wants to speak, all the panelists. Somsekhar sir, you have any final words?
Yeah, I just wanted to share that children are powerful disseminators of information, and getting the right information to them and having them practice the right things will actually help ensure adults follow it. So getting the right messages, because the messages are not very complicated, they're very simple. Getting the right messages to children, hopefully via schools or via teachers, might be actually a much better way. Thank you.
Thank you very much, Somsekhar sir. Dr. Sandhya, you have any final words?
No, just what I said, that, like prevention is the cure. That even when everything feels out of control, There is something in your control, and that is your behavior. And by changing our behavior, we can go a long way to protecting ourselves and protecting each other. So really, India needs to get together as the team of 1.39 billion and stop this second wave.
Thank you very much, Dr. Sandhya. Pooja, ma'am, you have any final words to say to all
Yes,
of us?
I was going through questions and I will bust one more myth. लोगों को लगता है सुसाइड के बारे में बच्चों से बात ही मत करो, वो उनको बचाएगा. But fact is कि आप जितनी ज्यादा बात करते हो और बच्चों को लगता है कि उन्हें हेल्प मिल सकती है, वो उनको बचाएगा. So let's keep talking about mental health. बात नहीं करना और सिर्फ be positive कहना is not effective. Thank you so much.
Thank you very much, all the eminent panelists, and thank you very much. Now, I would like to request Kanchrila sir to invite K.M. Singh sir for the concluding remarks here.
Yes, so
Thank
it's
you,
been
sir.
a wonderful, wonderful 3 hour session, and we are now coming to the last moments. There is a whole treasure and wealth of experience, knowledge, and practical inputs from all our panelists. Wonderful panels. So over to you, Shri Singh sir, for your final words, and you have also a lot of wisdom, and we would like to hear your final words.
Thank you. First of all, it was not a 3 hour session. It was supposed to be 3.5 hours, and now we are at the end of 4 hours. I must appreciate the patience of all panelists.
Sir, your voice is low. Can you come closer?
हाँ, थोड़ा सा सर माइक के क्लोज जाके और बोलिएगा तो और अच्छा आएगा. बहुत अच्छा है सर.
No, I must appreciate the patience of all the panelists to stay back for 4 hours. I, for one, my plan was, I know that I'm not very well, so I had no plan to stay beyond 1 hour, but I have really enjoyed staying and listening to the presentation for these 4 hours. Compliments to NIDM. First of all, thinking of this subject, which is, I feel, is left untouched so far in a comprehensive manner. But I must also compliment selection of such brilliant experts with plethora of knowledge who kept us engaged for a long time. And I think each one of us have been gained by today's this webinar. Webinar has become the order of the day nowadays. And I almost every week I attend 1 or 2 webinars. I have no hesitation in saying that probably this is the most enriching, most knowledgeable webinar I have attended. Brilliant presentation. What brilliant presentation. I have no word to explain. Now, time is very short because we have already time. I don't want to take unnecessarily a lot of time, but I will only say that Santosh has said a very good point. He has said that we should move from circle of concern to circle of influence in the recommendation, 1-pager. Dr. Raka, you have a very difficult task assigned to you in 1 page to put all those things. There's a proverb in Hindi saying, Gagar mein sagar.
We will ensure that. Sir. We will ensure that, and we'll put up to you within next days.
Gagar of sagar, but you have to do that because the outcome of recommendation, if government takes it seriously, will be very, very enriching for the entire society. This is the conference which has highlighted how children has to be in the circle of entire family milieu and everything. Lastly, I would like to say that there have been some discussion between complacency and positivity, positivity and optimism, and different views. At the end, I want to say that in our approach to this issue, there has to be a judicious mixture of optimism and lack of complacency, both. If we have a judicious mixture of lack of complacency and optimism, then I can only say, hum honge kamyab ek din. Thank you. Thank you to the entire NIDM staff, Professor Santosh Kumar Raka and his team. It's a brilliant webinar. Each one of us, I'm sure, have enjoyed it. Thank you.
Thank you very much, sir. Now I would like to request Kancharla, sir. So you, along with our entire team, Dr. Balu, Sri Ranjanji, can provide us with the final vote of thanks, sir, today here, because we are already too much extending the time, and the presentations and the talkings were so engaging that I didn't ever find it disturbing anyone in between. So thank you and apologies for not keeping up with the time. Kancharla, sir, for final vote of thanks along with the entire team of CCDR.
Yeah, thank you. And I would like to be very brief. And Shri K.M. Singh sir has set a good example to be very brief, and that is the bliss of today. So, and to all our panelists who have actually spoken, not just from the academic knowledge, but from the heart, to see that the issues of children, the concerns of children, and the lives of children and their rights are ensured with their well-being, safety, and to every one of you, a big, warm-hearted gratitude for this half a day's and even extended time, your contributions to this cause. NIDM and all at NIDM and everyone who has been very proud of you, very proud of you. And to all the illustrious participants who have sent numerous comments saying that this is excellent and we would like to receive the presentations and continue to learn. So this learning will never stop. So once again, a billion thanks to every one of you right from Auckland. We have had people speaking from south of India, north of India, and all parts of India, and the participants are from the global world. So everyone, we all get united. And the last word that came is that we cannot borrow anymore from children, but we must give it back and improve the future for everyone. Thank you, and
Thanks.
a billion thanks once again.
Thank you very much, Ray sir. Now I would like to invite Dr. Balu for formal vote of thanks and closing up the session, please.
Yeah. Thank you so much, Dr. Prakash, sir. It's my immense pleasure to extend my sincere gratitude to the patron of this program, Major General Manoj Kumar Bindal, sir, Executive Director, NIDM. And I also extend my sincere gratitude to Sri K.M. Singh, sir, IPS retired, former and founding member of NDMA and Vice President of PPF Foundation. And I also extend my sincere thanks to Professor Santosh Kumar, sir, Project Director, CCDR Center, NIDM, and Sri Sarjit Singh Sota, Emergency Specialist, DRR Section, UNICEF, for their guidance in this successful completion of this webinar. And I also extend my sincere gratitude to the Ray Kancharla, sir, who is a part and parcel of our CCDR Center, who is constantly supporting us for organizing a lot of webinars and training programs. And I also extend my sincere thanks to Professor Rajiv Das Gupta, who has spoken about public and community health aspects in the third-person Center of Social Medicine and Community Health, JNU. And I also extend my sincere thanks to Dr. Naveen Thakur, who has spoken about vaccination concerns and issues, and who is also Executive Director for International Pediatric Association. And my sincere thanks to Professor Somsekhar, sir, who has spoken about safety and security and educational concerns. And I also extend my sincere gratitude to Dr. Santhya Ramanathan, who has spoken about preventive and protective measures. And finally, I also extend my sincere gratitude to Ms. Pooja Priyamrada, who has spoken about mental health issues and psychological aspects of children. And finally, I also extend my sincere thanks to my team members, Dr. Kumar Raka, sir, who has convened this webinar and moderated successfully. And I also extend my sincere thanks to Mr. Ranjan Kumar, who has provided technical support. And final thanks to all the participants who made this day as very successful. Thanks to each and everyone.
Thank you very much, Dr. Balu. With permissions of our eminent panelists, they can leave now, so that after that you can give the details to the participants, how they can receive the certificate and feedback form, and etc. etc. So this is the now general thing, so that you can take care of it. And overall, with all the benefits, all the participants, thank you very much. May be, we will be meeting soon. We have to fight together again and again. Thank you. Thank you. So, Dr. Balu, feedback forms on the platform, and after you can just discuss with the participants whatever you want to with regards to receiving the certificates, actually.
Yes. Dear participants, I have given the registration link in this chat box. It is mandatory to register our NIDM training portal and enroll in this particular course for receiving a certificate. And the second criteria is you should have minimum 80% of attendance for receiving the certificate. And after 2 days of completion of this course, the same place where you have registered for this course, you can download your certificate. So it will take 48 hours to upload your attendance and certificate. So I'm requesting all the candidates to kindly register yourself in this particular program. The link is given in the chat box. So it is mandatory to register and enroll in this course and to have minimum 80% of attendance for receiving the e-certificate. So the link is given in the chat box. Please kindly register all of you yourself. Yeah. Thank you.
Thanks to all participants for giving time to joining the workshop. और मैं NIDM से की तरफ से सभी को धन्यवाद करता हूं कि आपने एक बहुमूल्य समय आज के इस वर्कशॉप में दिया, और इससे यहाँ जो आपने लर्निंग किया है लोगों के बीच में जाकर शेयर करेंगे, जिससे कि हम रिजिलिएंट लोगों को रिजिलिएंट बना सकें। थैंक यू। बंद कर दें। नहीं, इसको कर रहे हैं क्या? नंबर ऑफ पार्टिसिपेंट अभी है 194 है। बालू क्या करना है? बंद कर दें। बालू अब बाहर हो गया। हेलो, बंद कर दें। ओके ओके ओके। एक्चुअली अभी सभी लिख छोड़ दो। ठीक है। छोड़ दो, फीडबैक फॉलो विचार फॉलो फॉलो ये कैमरा ऑन करके रखना, कैमरा ऑफ कर दो। लिख दो, प्लीज फिल अप द फीडबैक फॉर्म, दोबारा शेयर कर दो, और छोड़ दो। सब ऐसे छोड़ होता है जैसे इसमें इम्प्रूवमेंट ये है ना कि एक ही दिन नहीं रखना था, दो दिन दो पार्ट थोड़ा कम और कोई काम धंधा नहीं है क्या? हेलो हेलो। अरे एक्चुअली कल रात में क्या हुआ था कि हमारे एक रिलेटिव का कोविड के कारण कुछ ज्यादा हो गया था ना, तो उसमें मैं व्यस्त हो गया, उनको अरेंजमेंट करने में, दवा ववा सिलेंडर दवा टाइम नहीं दे पाया हूँ। अभी जस्ट मैं आज करता हूँ, अभी भी सुबह से वहीं लगा हुआ हूँ, तो जस्ट थोड़ा टाइम दो एक चीज। हाँ हाँ ठीक है ठीक है भेजता हूँ। ठीक है भेजा ठीक। रेमिडी स्पेयर मिल गया सर।
भी एक बार तो वहां पे तो रगड़ा हो जाता है, वहां पे काम हो रहा है, लोग लड़ रहे हैं, कम्युनिटीज लड़ रही हैं।
होगा
हाँ?
होगा
तो ब्लैक मिलर कौन आदमी है?
उस टाइम पे ब्लैक
तो पूछिए ब्लैक क्यों ले रहे हैं? कौन आदमी है? मेरा नंबर भेजिए, मैं जो ब्लैक 2 मिनट में उसको एक्सपोज करते हैं, कौन ब्लैक 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 कर रहा है, जो बहन छोड़
जो देखा तो मर जाएगा।
नहीं, पहले ले लीजिए, उसके बाद गांठ मारते हैं।
जो भी देखा
नहीं, वो तो वहीं से आया ना, तो ब्लैक मार्केटेड भी है ना वहाँ पे, ऑक्सीजन से लेकर के एम्बुलेंस से लेकर के दवाई तक सब ब्लैक कर रहे हैं। बहन जो इन्हीं को तो रगड़ना है हमको।
जो बड़ा आदमी
पहले बोलिए, खरीद लीजिए, उसके बाद हम रगड़ देते हैं। नंबर दीजिए, कौन कौन सा आदमी है ये जिसने ब्लैक किया? नहीं तो नाम लिख के डाल दो, माँ चोर देगा उसका पब्लिक।
नाम
पहले ले लीजिए, पहले खरीद के रख लीजिए, उसके बाद मारते से तो नहीं आता है सब। मेरे मेरे मोबाइल पे तो ब्लैक वाला आता ही नहीं है। नहीं, मेरे पे नहीं आता।
नहीं वो वहाँ बात किया था
नहीं, वो सब उसी से हुआ है बात। नहीं, वो सब ऑनलाइन ही हुआ है, और कुछ रास्ता ही नहीं है।
और कोई रास्ता नहीं। बेंगलोर में और इसमें ऑक्सीजन का तो बहुत दिखाना। एक और प्रोग्राम है ना,
वेबिनार वेबिनार में पहुंच चुका
सर शांति मिला था तो बात सर में दर्द हो रहा था, एक मिनट हमें मालूम है कितना हो गया। नहीं करता हूँ मैं लाया
कौन कहा तुम क्या फर्क कर लिया ले लो अपना काम में करते एक पैक लेना सोने वाला सोने वाला एक पैक लेना
अच्छा नहीं करेगा
और देखो फिल्म संतोष कुमार दोनों बोल दिया गड़बड़ हो गई
इसलिए फाइनल
दिमाग में था, लेकिन इस एक काम कर रहा हूँ, तो तरीका बता मेडिकल कॉलेज में ये तुमको हम तरीका बता रहे हैं, उसको मैं बना बहुत बढ़िया किस्म के सब को इसको बना मेरे पास तो मुझे पता चला नहीं करे, ठीक है। अब लोगों सब तो आप पर डिपेंडेंट है, रिकॉर्डिंग होते हैं आप, बाकी तो आप ऑलरेडी नोट किए होंगे। मैं छोटा होता होगा देते रिकॉर्डिंग हम देते तो मतलब बंद करते हैं। जब ड्राफ्ट मिल जाएगा तब तक ना, तो हम ठीक कर हमको खाली ड्राफ्ट हमको ड्राफ्ट मिला मेरे सामने, बढ़िया, जितना बढ़िया ड्राफ्ट मिलेगा उतना बढ़िया।
खिचड़ी तो बंद करने की है, चल ही रहा है तो चल ही रहा है, बंद कर दो, बंद कर दे आप। अभी भी 115 लोग हैं।